this prayer in bahasa. Mari kita tundukkan kepala sejenak sebelum kegiatan ini dimulai dengan mengharapkan ridho dan perkenan dari Allah Subhanahu wa taala atas kegiatan kita pada pagi hari ini. Bismillahirrahmanirrahim. Ya Allah, puji syukur kami panjatkan kehadirat-Mu atas segala nikmat yang Engkau berikan. Engkau telah curahkan nikmat berupa waktu, kesehatan, dan kesempatan pada kami untuk menghadiri majelis Stovit online series dalam suasana pandemi ini di bulan Ramadan. Ya Allah, jadikanlah kegiatan ini adalah kegiatan yang bermanfaat untuk menambah ilmu pengetahuan mahasiswa, dosen, dan sejawat dokter gigi yang lain. Juga bermanfaat untuk melindungi rekan-rekan sejawat kami dalam melayani masyarakat. Mudahkanlah pelaksanaan kegiatan ini, ya Allah. Ya Rob, berikanlah kesehatan serta kekuatan lahir dan batin pada segenap pengurus dan anggota yang hadir di majelis ini, untuk selalu bisa mengemban amanah yang telah dibebankan oleh organisasi, oleh pemerintah, oleh institusi, dan oleh masyarakat. Berikanlah petunjuk, pertolongan, dan perlindungan, serta kemudahan pada kami dalam bekerja. Lindungilah kami semua dari wabah ini pada saat kami mengemban tugas dan amanah, pada saat melayani kesehatan masyarakat, dan pada saat kami mengajar, ya Rob. Akhirnya, ya Rob, bantulah kami agar kami dapat selalu meluruskan niat bekerja dan mengajar di bidang kedokteran ini, kedokteran gigi ini, semata-mata karena mengharap ridho-Mu Azza wa Jalla. Ridhoilah semua kegiatan di organisasi ini, dan jadikanlah ladang amal soleh bagi kami semua. Allahumma ini ala zikrika wa syukrika wa husni ibadatik. Allahumma inna as'aluka ilman nafi'an wa rizqan thayyiban wa amalan mutaqabbalan. Rabbana dzalamna anfusana wa illam taghfir lana wa tarhamna lanakunanna minal khasirin. Rabbana hab lana min azwajina wa dhurriyyatina qurrata a'yun waj'alna lil muttaqina imama. Rabbana atina min ladunka rahmatan wa hayyi' lana min amrina rasyada. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina adzabannar. Walhamdulillahirabbil alamin. Wassalamualaikum warahmatullahi wabarakatuh. Terima kasih.
Thank you, Dr. Aksa. Well, ladies and gentlemen, we have Dr. Milen Guevara Ikrube, PMD FPFA, as the first speaker. She will talk about efficient aesthetic with composite resins. And today's lecture will be moderated by Dr. Gigi Nur Hikmah, Specialist Konservasi Gigi Consultant from Universitas Hasanuddin. Dr. Gigi Nur Hikmah is one of the staff in Conservative Dentistry Department, Universitas Hasanuddin. She finished dental bachelor degree in 2002 and became conservative dentistry specialist in 2014. Then she was awarded as a consultant in 2019. But before we start, to all participants, we will have a discussion session at the end of each lecture. You may ask your question and put it on the Zoom chat. Also, we will have a post test in the end of this webinar. Dr. Nur Hikmah, as a moderator, time is yours.
Thank you, Master of Ceremony, Dr. Ratna, the Honorable, the Dean and staff of Dental Medicine Faculty, Universitas Airlangga, Dr. Gigi Agung Setiawan MKes, the Honorable, the Dean and staff of Faculty of Dentistry, Hasanuddin University, Dr. Gigi Muhammad Ruslin, PhD, SPBM Consultant, the Honorable, all the speakers, especially for Dr. Milen Guevara, the MD, FPFPA, as the first speaker today. Our college, ladies and gentlemen, distinguished participants, good morning and best regard to all of us. Assalamualaikum warahmatullahi wabarakatuh. Robbi srahli sodari wa yassirli amru wahlul uddatan bil lisani yafqahul qawli. Amma ba'd. Alhamdulillahi rabbil alamin. Allahumma salli ala Sayyidina Muhammad wa ala ali Sayyidina Muhammad. For the first, my name is Dr. Gigi Nur Hikmah, Conservative Dentistry Specialist, and I would like to thank you to organizing committee to give me the opportunity to become a chairperson today. That the Stovit online sharing that held by the Dental Medicine Faculty, Universitas Airlangga, collaborating with Faculty of Dentistry, Hasanuddin University. For the first session, gonna be delivered by Dr. Mylen Guevara, and she would like to present her paper with the title Efficient Aesthetic with Composite Resin. Okay, before she begin the presentation, I would like to read a brief introduction of her. Name, Dr. Mylen Guevara Igrube, DMD, FPFA. Her head office in Enhanced Dental Kingwood, Makati City. An educational attainment, postgraduate program in aesthetic dentistry, University of California, Los Angeles, School of Dentistry, UCLA. And Doctor of Dental Medicine, University of East Manila, 1993. Dr. Mylen receiving award, Holy Cross College Most Outstanding Alumni Award in Dental Profession, November 29, 2015. Pampanga. Okay, that's the introduction of her. And for all the participants, if you have any question, please fill in the Q&A box. So, Dr. Mylen, it's around for you 45 minutes for your presentation. And
okay.
The floor is yours.
All right. Thank you. And now I have to share screen. Okay. So are we good now?
Yes,
Okay.
Doc.
Okay. So okay. My screen is clear.
Clear, Doc.
Okay. My voice is also clear, right?
Yeah.
Okay. Okay. So okay. Good morning to everyone. I am Dr. Mylen Guevara Igrube, a past president and of course director of the Philippine Academy of Aesthetic Dentistry. Before I start this lecture, I would like to thank the University of Erlangen and Ivoclar Vivadent for the invitation to lecture on this Stovit online series. I am humbled to give you this lecture entitled Efficient Aesthetics with Composite Resins. Though it's pandemic and everybody is wearing face masks, and here in Manila, we are not only wearing face masks, but we also wear face shield. We dentists should still give a functional and aesthetic restorations to our patients. And okay, these pictures actually were taken during my lecture and hands-on workshop in November 29 in your university. I hope and pray that this pandemic will end soon so we can meet again face-to-face and probably we do another workshop. So I guess some of you here are present. I hope so. Okay. So let's begin with the tooth life cycle. Okay, this is a tooth life cycle. We all know that dental caries is one of the most prevalent human chronic diseases worldwide. When a tooth tissue defect is formed, restorative treatment is a common approach. A cavity is filled, most likely with a resin composite. If secondary caries is formed under the old filling, then a new filling is placed. But if by chance the tooth fractures or another cavity form under the filling, root canal treatment is needed to save the tooth and crown becomes unnecessary. If the tooth can no longer be saved and need to be extracted, then an implant prosthesis can be considered to replace the missing tooth. So our objective here is to learn how to restore teeth conservatively with composite resins for aesthetics and also for function. So modern restorative dentistry is essentially based on adhesion. This allows to comply with the three vital parameters of aesthetics, function, and preservation of sound tissues. And modern restorative dentistry should be in keeping with the biomimetic and bioemulation concept. This means your restoration should reproduce the physiologic behavior of the natural tooth as much as possible with biologic, biomechanic function, and aesthetic integration. And our currently, the anterior and posterior direct restorations are based on adhesion. Adhesion means it is the capacity to bond materials to tooth effectively. Okay, so here we use we have different adhesive adhesive treatment before restoring tooth. Okay. So in our everyday practice, we encounter the following cases, right? So I'm sure you've seen cases like this. These are actually cases in my clinic. So the question now is, what treatment options are available for patients with dental wear and tooth structure defects? And today, it is often to use less invasive or non-invasive procedure to achieve results which are highly regarded or highly valued by patients. The skillful use of our composite resins can deliver highly aesthetic results in a single treatment session. They enable a minimally invasive procedure. Even patients suffering from functional disorder can be treated using a gentle and conservative method. Okay, what about our composite? So composite, according to Skinners, is a highly cross-linked polymeric material reinforced by a dispersion of amorphous silica, glass, crystalline or organic resin filler, particles and or short fibers bonded to the matrix by a coupling agent. So here, you can see here the chemical composition of composite resins. Again, it consists of a resin matrix, and this resin matrix is responsible for giving the strength, plasticity, and the curing characteristics. While the organic filler, like the silica, quartz, silica, and so forth, these improved materials are responsible for the compressive strength, the elastic modulus, the hardness, and wear resistance. And what about the coupling agent? So the coupling agent, actually, this is the chemical link of the filler and the resin matrix to achieve bonding of these two phases, the resin and the inorganic filler. And of course, it has an initiating system, the initiator like the camphor quinone, for polymerization reaction, and of course other materials like the colorant to achieve enhancement effect of the composite. So composite resins are classified into four categories. Number one, according to its restorative procedure, that's why we have the direct and the indirect composites. Next, according to its clinical applications, that's why we have the packable composite, the flowable composite, the polyacid modified, the self-adhesive, the osmotic, and recently, of course, we have the, not recently, but the bulk fill composites. The third one is the curing modes. First, the chemically activated, you have the composite light activated, the heat cured, and the dual cured. And the most popular ones are categorized according to filler particle size. We have the macrofill, the microfill, the hybrid, the modern hybrid, and the nano composites. Okay, resin composites are increasingly used as the dominant choice of most patients and most dentists for dental restorations because of their aesthetics and direct feeding capability. We have so much about composites, but today we will focus our discussion on its aesthetic side. So we're going to talk about the translucency, the masking ability of the composite, the shade matching, shade intensity, the fluorescence, and of course the polishability of this material. So what about translucency? Translucency simply means it is a property of an object or a material that permits the passage of light, but disperses the light so objects cannot be seen through the material. And it is also the intermediate state between a complete opacity and a complete translucency. And here, you can see here, translucency and lightness interact. This means that our oral cavity presents a dark oral background. Remember, when the patients open their mouth, what you see is, of course, at the back of the teeth or the front teeth, it's a dark background. And therefore, it says that the more translucent the restoration, the darker it will appear because of this dark background. And there's a journal of aesthetic and restorative dentistry. They have this, they present this, the translucency of value resin composites used to replace enamel in stratified composite restoration techniques. And this article states that translucency of enamel shade affects the color of a layered restoration. Okay, so the clinical significance of this, the results suggest that special attention should be paid to the thickness of the increment of value composite resins when producing translucency of natural tooth enamel. High value composite resins were more translucent than medium value composites, which were more translucent than low value composites. The translucency decreased as the thickness of the specimen is increased. Another journal from Dental Materials, the color and translucency of resin composites for layering techniques, it states here that enamel shade composites, they are more bluish, while the opaque shade composites, they are less translucent, they are brighter and yellowish in character. So what's the clinical significance of this study? In the layering technique, it is fundamental to have an accurate knowledge about the translucency and colors of the material shades used. And what about this essential technology? Essential technology actually is a patented technology from Ivoflor Vivadent, and it represents a milestone in the aesthetic optimization of a 4mm composite. So basically, this is for the bulk fill, particularly on the bulk fill flow of the tetric and ceram. This material features a high initial translucency to achieve the desired depth of cure. At first, when you apply it, it is translucent, and while it polymerized, the material gradually changes to a more opaque shade. So you can see here, it turns from translucent, it turns to a dentin-like translucency. The translucency now is less than 10% compared to the unpolymerized material, which is 20% translucent. Okay, so you can see here, this is a cured bulk fill flow. They use for a class 2 restoration. They use it. You can use it to establish first the proximal wall, and then cure it, and then you apply another layer. Probably I use it before I use the packable composite. So initially, for a class 2, establish first the proximal wall with this bulk fill. Remember, it's a bulk fill flow, not the conventional not the conventional flowable, but it's a bulk fill flow. And then once I establish the proximal wall, then a layer of 2 to 3 millimeter of this bulk fill flow, and then I polymerize it. And then once it's polymerized, then I proceed with the packable composite. Okay, next to consider. Now we go to the masking ability or the efficiency of the composite. So your composite should be able to mask discolored tooth. Either it is endodontically treated or tooth has been with trauma for the traumatic teeth. So here, this is my case. A patient who doesn't want to have a ceramic restoration. She opted for a direct composite restoration. So I gave this patient direct composite veneer to mask off this discolored tooth. I use a very thin layer of opaquer, and then after the opaquer, I use an A3 dentine, and then followed by an A2 dentine, and lastly, an A2 enamel. You can see here, I did not only restore the tooth number 1, but also I also restored the adjacent tooth, which is tooth number 2, because we all know that the two central incisors, they are dominant teeth in the mouth. That's why it's really hard to restore this tooth, especially if it's a single tooth only. That's why sometimes it's advisable, or it's nice to restore also the adjacent tooth as well. Okay, for another discolored tooth, this is a patient in our clinic, a post-orthodontic treatment. But then again, the patient was not happy with the her lateral incisor, tooth number 1, 2. So again, I prepared the tooth for direct composite veneer. I use an opaquer, but then again, look at the adjacent tooth. They have a remarkable fluorosis. That's why I use a white tint. By the way, when you use a white tint or any color, you use it after you apply your dentine. Do not apply it with after your enamel or your last layer. Otherwise, it will just be washed away, or it will be abraded when the patient brush his or her teeth. So here I use an opaquer. I use a white tint for the fluorosis effect. Next, for a complex class 3 and class 4 restorations, these are the cavity that has a true and true. We have a through and through situation, like a big class 4, if I may say. So after removal of the caries, okay. So here, my concern is I want to block off the dark corner of the mouth, as mentioned a while ago. So here I use a bleach shade. My initial, I build up the palatal wall with the bleach shade. This is to block off the dark corner of the cavity. And I use a white tint again to compensate the fluorosis of the adjacent teeth here. I use an A3.5 dentine and an A3 enamel as my final layer. Of course, no. Here in Manila, we still have the amalgam here. But then again, if the patient requests for a removal of amalgam, definitely what you will see is the stain. You get a stain from amalgam, right? So here, when you remove it, you are what do you call this? You will find stains, and if you don't know how to mask those stains, then you will get a grayish restoration. So here, what I did here, I remove it, and then to mask the dark stain from the amalgam, I use this bulk fill flow, and then I use the sculptable or the packable composite after. Or you can use the conventional composite if you want. And what about this? The dual cure composite, stains from an old amalgam. So there's a secondary caries formation underneath the old amalgam filling. So remove it. And then what you see again is the dark staining coming from the amalgam. So here I use the Cention N with a dual cure composite, and I don't see any dark discoloration beneath. Next to consider is the natural fluorescence. No? So when you say fluorescence, this is actually ability of dentine to absorb radiant energy and emit it in the form of a different wavelength. And dentine generates internal luminescence and appears to be 3 times more fluorescent than our enamel, because our enamel are more translucent. And to be able to have this natural fluorescence, your composite should also possess fluorescence. And then this fluorescence actually is produced by special pigments which absorb energy from UV light and immediately emit it as a visible light. So when you want to have a nice aesthetic or a nice restoration, maybe you can check your composite if this composite has fluorescence effect. What about the polishability? This is very important because this is actually the essence of aesthetic dentistry. So our composite surface roughness is basically dictated by the size, hardness, and amount of filler, which influences the mechanical properties of the resin composites. It is also influenced by the flexibility of the finishing material, the hardness of the abrasive, and the grit size. That's why hybrid composites, if you are using hybrid composites on your anterior teeth, you cannot achieve a good polish because the fillers are basically big fillers. And this one, no, I just read an article about this filler technology. This filler technology actually, if you want to have a good polishability, it requires many fillers as much as possible, small fillers as much as possible, and spherical fillers as well. So the filler technology from Ivoclar Vivadent possess this good polishability and gloss retention because they have these prep polymerized fillers that allow for a high filler content while still employing small filler sizes. So meaning the requirement was satisfied with this filler technology. And another thing to consider when doing a finishing and polishing your composite restorations, I use this disc, a carbide finishing burst, and a polishing with rubber points. Okay. So now let's go to the essential guidelines in restoring teeth to direct composite surface. Can I proceed? Okay. So number one to consider is your shade selection. This is a reminder to everyone. When you do shade selection, you turn off the light of your dental chair. And then turn off the light of your magnifying glasses. And do not air dry or isolate the tooth prior to shade selection because it says here that enamel will desiccate rapidly, resulting in a much lighter and more opaque appearance of the tooth. And hydration of enamel by water absorption will take at least 30 minutes, according to Russell et al., to see the initial natural color again. And then if you want to check the chroma or the shade of your dentine, select the dentine shade by comparing the shade guide with the shade you will find in the cervical third of your canines. Not only, though you are restoring the central incisor, it's better to get the dentine shade on the canine. Okay, so if you cannot decide between two shades, you pick the darker one. And then another one thing to consider, you can light cure the composite for more accurate shade assessment. I always do this. I get a small amount of composite and then place it on the labial surface and then I cure it. Or you can use this, what do you call this, an accessory, the Smile Light from Style Italiano, or you can have the lampu to check the color, no, with cross polarization filter. So the cross polarization filter, they remove the when you use it, the glare, no, the glare is being removed from the tooth surface. Okay, next to consider, check the translucency. Again, translucency really matters because here, then you check our enamel, the cross section of our enamel. The enamel regulates the value or brightness of the tooth, and it is characterized by high degree of translucency. Therefore, when enamel composite is used in high thickness, it develops the so-called glass effect, and the restoration becomes gray. So be careful when applying your enamel composite. You just apply it sparingly. And take note the thickness of the composite from the cervical thirds. The enamel there is only 0.3 millimeter. And as you go incisally, like for the middle thirds, it becomes 0.5 millimeter in thickness, while on the incisal thirds, it becomes more. It's more of 7. It becomes 0.7 millimeter in thickness. Again, for the shade selection, you have to consider also the age of your patient. And teeth becomes more translucent with age according to Barrietieri. Younger teeth, they have high value due to high color of dentine and unworn enamel, while for the aged teeth, they have this darker hue due to darker dentine color and thinning of enamel due to abrasion. Next to consider is your tooth morphology. Okay, you have to go back to the anatomy of your teeth. So what you would like to check here are the vertical lines, the ridge line, the presence of the mamelons, the translucency or the pallescent enamel there, and of course if the incisal edge has an halo effect. Another thing to consider, like me, I personally do the wax up for my patient. This is to establish also the tooth morphology. Before I start a restoration, I diagnose, and then I take an impression and have a good cast, a diagnostic cast, and from there I have I will do my wax up, and then from that wax up I can have my putty stent guide for before I do the cavity prep or any preparation that I want to do. So now let's go to the preparation. Always prepare a facial bevel, especially for class 3 and incisal fracture buildup, if you want to restore it. Then bevel should be convex shape and all sharp edges should be smoothed out, because light scatters differently in a bevel with sharp edges than in a bevel with a convex shape. So here, okay, this is not my case. Actually, I just got it from Style Italiano. Here, all sharp edges were rounded up, and 2 millimeter were placed with the diamond burr or a coarse disc. Now, if you don't know how, or you are very particular with your preparation, if you are scared to for your if you are scared on oh, I might be reducing a lot, then maybe your coarse disc can do this. Okay, so use a diamond burr or a coarse disc. What about adhesion? Here comes adhesion after the preparation. So I etch the prepared and unprepared enamel with 37% phosphoric acid for 30 seconds. So nowadays I use this selective etch technique. Okay, so the selective etch technique, you only etch the enamel and then for 30 seconds and then wash it. Okay, you just wash it, rinse thoroughly with water, and then dry. And then apply your adhesives. I basically use the universal adhesives by scrubbing on the dentine for 20 seconds. Okay, these universal adhesives, they dissolve the acidic monomer, dissolve the smear layer. So by scrubbing it on the dentine for 20 seconds, and then gently air dry until there's no movement of fluid, because here we want to evaporate the solvent prior to placement of our composite, no? And then you cure the adhesive now. Now here, there's a journal on dental science about the selective enamel etching. So it says here that previous enamel etching resulted in fewer marginal defects and marginal discoloration compared with using the self-etch approach alone. So we etch the enamel because we want to have a good marginal adaptivity of our composites. What about the anatomical layering? Of course, after the adhesion, after we put our adhesives, next we place our composite resins, and we have to do the anatomical layering. Anatomical layering, it minimizes the effects of shrinkage. So we have to prevent further shrinkage because we don't want the post-operative sensitivity, right? So we eliminate air entrapment and prevent material from pulling back from tooth structure during instrumentation. Some composites, they are really very difficult to manipulate, no? So you have to be careful because pulling back, sometimes you don't see that there's a pulling back and you create a space there, and therefore you will not get a good restoration. And then with the anatomical layering, you placement of various composite layers with varying opacities and color. This is to replicate normal tooth structure when you do this anatomical layering. And for the young enamel, you have to consider you're a young enamel, they are bright. Sometimes you need a white tint, and they have high opalescence but less translucent. They are less translucent, while the adult enamel, they have a neutral tint, less opalescence, and they have intermediary translucency. But for our old enamel, for our aged patient, they have a yellow tint and higher translucency shade. Now, I have this patient before. I only have the A3.5 enamel shade on my composite, and it's still not compatible with the yellowish tint of his tooth. So to compensate with this, I use a yellow tint. I use an ochre tint for this patient, just to have a higher chroma of my restoration. Okay, now for the anatomical layering for a class 4, first you establish the palatal wall with enamel composite. This has to be 0.3 to 0.5 millimeter thickness. By the way, this is possible with the use of your putty stent guide or your silicone stent guide. Okay, and then establish the interproximal wall next with enamel composite. So after you establish the palatal wall, you cure it, and then proceed with the interproximal wall using your enamel composite. I use an APC instrument. I want a very thin IPC instrument when I establish this. And then next, apply your dentine composite and establish the mamelons. Okay, be careful when applying your dentine. Make sure that your dentine is quite measured, and it is really the shade of the natural dentine when you're using your dentine composite. And then for the final layering of the composite, okay, you use your enamel, and then I use this optoscope pad because I want a very nice finish of my enamel layer, or you can use your aesthetic brush also. What about the finishing and polishing? Your finishing, when you do finishing, you create and you refine anatomical shape, and you can adjust articulation and occlusion. After this, if everything is okay, then you proceed with the polishing. The polishing, it simply removes the oxygen inhibited layer to create a smooth and glossy surfaces. Now, the question is, which kind of composite should I use? Flowable versus sculptable. For a flowable, I'm talking about the conventional flowable that you have. For the conventional flowable, you can use it for more precise application of thin layers or the thin bevels, or for your small restoration of all types. I use the flowable conventional composite, the conventional flowable composite, as a liner only, okay, because these are very weak and it has a high polymerization shrinkage. Now, for the sculptable, it has a better physical properties, and it has you can have easier contouring of anatomical structures. Now, conventional versus bulk filling. Conventional composites, you can use it for anterior and posterior region. They have a wide range of translucencies and broad selection of shades. For the bulk filling, you only use this for your posterior region. No, do not use this bulk fill for your anterior teeth. Okay, so I'm going to share also with you some clinical case I've done in our clinic. So this is a class 4 and a diastema closure. So this patient comes to our clinic. This is the initial situation. What are the problem list here? The patient says that these are the grayish restoration. He doesn't want to have this grayish restoration. And I see also asymmetrical central incisors. And you can see there's a compromise with length ratio. Actually, this patient, when he came to the clinic, the restorations are actually, you know, they are already not, they're no longer intact, you see? And I was surprised when he said to me, you see, doc, I can remove this with my bare hand. So I was shocked because when he removed it, and then after that, he can place it again. So I said, oh, you have, I joke around and I said, oh, you have a removable restoration. It's like a removable denture, actually. Okay, so what are the materials that you'll be needing here? I have the silicone stent or the putty stent, and then I have the adhesives. Here I have the mylar matrix. I use the bleach shade because once I remove the old filling here, what I can see is the dark the dark background of the oral cavity. Of course, I need a dentin shade, an enamel shade, my finishers, and my polishers. So you can see here, I remove it, but before I remove it, I have the putty stent already, and then I remove all the sharp angles, and then I put some bevel also. Okay, so the procedures are the following. I etched and prepared the prepared and unprepared enamel with 37% phosphoric acid for 30 seconds, and then wash it for 10 seconds. So please, you have to wash it. Okay, otherwise, if there's a remnant of phosphoric acid here, especially when you're restoring posterior, it will give you a really a headache because patient will complain of hypersensitivity because of these remnants of the acid. And then the next, it's the application of the adhesives. Again, I use the universal adhesives, agitate it for 20 seconds, air dry for 20 seconds to remove the solvent, and then cure it. So your adhesive should be glossy in appearance, okay? In order for you to have a good adaptation of your composite material. Okay, so this is my stent, my silicone stent or my putty stent. I established the palatal wall with a semi-translucent enamel shade. I use a bleached L shade here, okay, and then I cure it. And then you can see here, I cut the putty stent on the interproximal wall because it's so hard when sometimes when we hit the interdental papilla, it will bleed. Okay, so if this interdental papilla bleed, then it's so hard to stop bleeding. And if you stop the bleeding, then it will give you a remnant, of a brown pigmentation, and it will be incorporated to your composite, and it really gives you a headache. So what I do, I just cut this to accommodate my mylar matrix there to establish the proximal wall. I now use the enamel shade here. And then the next is I establish the first dentin layer with this. I use an A3.5 dentin shade of the Empress Direct, and then followed by a second layer of dentin. So first, on the first dentin layer, it's a highly chromatic dentin shade, followed by an A3 dentin shade. So I reduce the chromaticity to A3 dentin shade. And then from there, from the second dentin layer, you can, if you want to create a mamelons, please, you can do so. And then in between the mamelons, you can apply the trans opal shade on the incisal thirds. And then next, of course, you establish the enamel, the last layer with the enamel layer composite, a shade A2 composite here. And then I contour, give an initial contour, initial polishing, and then I restore the adjacent central incisor. Of course, with the material, I use the carbide tungsten burr and the Astropol polishers from Ivoflar. So this is the before and after restoration. This is no longer a removable composite restoration, but rather a definite fixed composite restoration. Okay, clinical case number 2, a complex class 3 I've done. So what's the problem list here? The patient has a lot of interproximal caries not only on the anterior but on the posterior, because the patient is very fond of sweet foods, sweet drinks, like that. And of course, you can see there are all composite restorations here. So for the shade taking, I use the lampu for the cross polarizing effect. So to get the shade of this tooth, so I use an A3.5 dentine here and then A2 enamel, and then I cure it and then take a photo, okay, just to verify if my shade is correct. And then cavity preparation, I remove the caries. You can see at first I thought before, you can see that, oh, this is not only a small plastry, but when I remove the caries with round burrs, oh my God, it's a very complex plastry also. So we only, here I only restored first the 2 central incisors as per request by the patient, because he was already tired opening her mouth actually. So I etched the prepared and unprepared enamel with 37% phosphoric acid for 30 seconds. So again, it's selective etch, okay? And then I apply the universal adhesives. And then here, I used the fingertip technique. I did not have the, I don't have an ample time to have the stent. So using my fingertip technique taught by Dr. Marcus Leonard, I established the palatal wall with a semi-translucent enamel shade, because this is a through and through cavity. I need to block off the dark oral cavity, followed by layers of dentine composite, okay? And then final layering of enamel composite layer. And then next, I also restored the adjacent 1-1 with composite. So contouring, finishing, and polishing was done. And this is my finished restoration after. So it's before and after restoring the class 3 cavities. Next, incisal fracture restoration. Problem list here, I have, this is actually my secretary, a part-time secretary, and when she got a job to a bank, because she's actually, she only did a part-time job in our clinic, and then she decided to leave, and then it was Christmas season, and she got drunk because of the party, and then she accidentally hit the, what do you call this, a wall, maybe because he was really tipsy. Imagine this patient has no cavities, 0 cavity. Look what happened. Because of the accident, there was a big fracture. But fortunately for her, there was no pulp exposure. So you can see here, there's also incisal chip on tooth number 22, okay? And then sharp edges were rounded. By the way, I put anesthesia, local anesthesia, because these tooth are very sensitive. They are very sensitive. And even when I took what do you call this, a periapical X-ray to verify the pulp condition, the patient was really sensitive. So she's under the local anesthesia when I remove the sharp edges. So this is the patty stent. So the patty stent is made up from your rubber impression. No? So this is very important for your incisal edge position, embrasure forms, and your palatal anatomy. And then I isolate the adjacent tooth with the Teflon tape, because as I mentioned a while ago, the patient, if my anesthesia wears off, it is very sensitive, and I don't want the resin adhere to the adjacent tooth as well. That's why I isolate it with a Teflon tape. So you can, okay, I etch and prepare the unprepared enamel with 37 phosphoric acid for 30 seconds with a selective, okay. So actually, you can also do the total etch technique here. I guess this is a total etch technique. I've done a total etch technique here, not selective etch, but I use the universal adhesive here, okay, because this universal adhesive, it also has immediate dentine sealing as well. Also, I want to seal also my dentine to prevent this postoperative hypersensitivity. So again, fitting of patty stent inside the patient's mouth. take note, I again insert the mylar matrix from the patty stand. Okay, and then before I proceed, I apply a thin layer of semi-translucent enamel shade on the patty stand. Do not cure this. Okay, you have to put it back on the patient's mouth, and then there you cure it. Make sure that the material is properly adapted on the palatal surface of your central incisor, then polymerized. So remove the patty stent and check. If everything is okay, then remove the patty stent. And then first layer of dentine, I put the first layer of dentine there, and then the second layer of dentine, and then also the translucent shade on the incisal in between the mamelons. And then I apply the last layer of enamel composite here, and then again I isolate the finished restoration, and then proceeded to the adjacent tooth. So same procedure was done on the adjacent tooth. So this is my finished restoration. So this is before and after. Okay, this is another case. This is not my case, but it is a case from Ivoclar Vividen. For the posterior restoration, they use this bulk fill technology. So they apply the tetric and flow bulk fill on the interproximal to establish the proximal wall, of course, and then you cure it. And then after you cure it, you can see the transformation of the translucent material to lesser translucent. So the translucency was lessened. And then after that, you can layer it with the tetric and ceram bulk fill, or you can layer it with your conventional composite. Then immediately, remove the what do you call this? The rubber dam and your matrix, and then trim and polish your posterior restoration as well, according to the occlusion of the patient. Okay, next. Okay, so I did not document this. I document this, but I don't have the step-by-step procedure. So this is a patient with the recurrent caries on his posterior teeth. So I removed the caries, and you can see, it's quite deep already. And I use the flowable. I use the bulk fill composites here, both the flowable bulk fill and the sculptable bulk fill. Okay, and then this one, a patient came in and then he said, "Oh, my tooth fractures, but doctor, my composite is still there. See, the composite is still there." So what I did, I removed. The patient said, "Oh, don't remove the old filling; it's still intact." See, but I said to her, "We need to remove that because there is an underlying caries formation underneath." So I remove it, and then this is actually a direct composite onlay. Okay, I use a bulk. This is actually a bulk fill composite also. So that leads to to end my lecture presentation. Lifelike restorations that are truly indiscernible can only be fabricated if an adequate range of dentine, enamel, and characterization material is available. We dentists have to use the best possible layering techniques to reproduce the shape, the shade, and other optical properties of teeth, such as translucency, fluorescence, and opalescence, in such a way that the teeth regain their original appearance, because polychromicity is the key for natural aesthetics. So these are my references for this presentation. And for your question and answer, if you are shy or you're not comfortable asking questions right now, you can direct your questions or your queries to my email address at enhanceddental@yahoo.com. Thank you so much. Keep well and stay safe always. Thank you so much. So I stop share. If you have, do we have time for our
Yes, sir.
Q&A? Yeah, do we have time for our Q&A?
Yes, Doctor. Thank you very much, Dr. Mylene, for your nice presentation.
Thank you.
Yeah. Now let us continue to the session question and answer. I think we already have 5 minutes. If participant, do you have any question, you can fulfill in Q&A box.
Or maybe Dr. Nur Hikmah, the participants can directly ask for Dr. Mylin.
Okay.
Dr. Nadia Nosla. So, do you have a question for Dr. Mylin?
Yeah, please.
Yeah.
Okay, so thank you for the opportunity for me. My name is Nadia Salsabilanosla, but you can call me Nana. And that was a great presentation for us. Like, thank you for the opportunity that we can watch that some of your cases. That's really awesome. Thank you. First, I want to ask for the second cases, the anterior restoration, composite restoration. For the when I do something like that, I ever have a patient like that before, but I never use that the Teflon tape that you use, and I usually have a difficulty for placing the matrix between when you use the putty index. Maybe can you give us tips and trick to place the matrix and the putty index and also the Teflon tape so we can place it easily in the patient?
Okay.
Thank you. Yeah.
All right. Thank you, Doc Nana. So
Yeah.
in my case, I isolate the tools with the Teflon tape. Usually it's really hard to, place the Teflon tape because sometimes it tears, right? So you have to be careful and then stretch it a bit. Okay, stretch it. And then you place it, because if you're not going to stretch it, it's quite thick. Okay, so it's quite thick. Now, after I do the isolation, usually if I do isolate the tooth, the adjacent tooth, because I don't want the tooth to get in touch with the adhesive, meaning the etchant and the adhesive. Now, if everything is okay with the adhesive, you can remove it, because I understand it will interfere with the placement of your putty stent, right? With the index. Now, what I do now, if I remove it, if you're going to remove it, then I cut the putty stent on the interproximal to insert now the mylar matrix or your celluloid. But me, I'd rather use the mylar matrix because the celluloid matrix is quite thick, okay, compared with the mylar matrix. Okay, so that's another option in doing that. Remove it, and then you if you want to get rid on the composite that it might adhere to the the unrestored tooth, then your mylar matrix will do the job. Okay. Thank you.
Yeah, thank you so much, Dr. Mylin. It's a great opportunity to watch your cases, some of your cases.
Thank you.
Yeah, stay healthy.
You too.
Okay, the first question. Maybe I think we still have a time to ask Dr. Mylan question. Maybe there's want to ask to Dr. Mylan, please. Directly ask for Dr. Mylan. We already have 1 minute before the time is up.
Good morning, doctor.
Yeah,
Good morning, doctor.
Yeah, my name is Hafiz. I'm from Universitas of Airlangga. Thank you for good presentations and for sharing your case for us. That's very inspiring. My question is, you mentioned on your presentations, there are classifications of restoration of composite, right? Such as backfill, sculptable, or backpackable. Yeah. My question is, how about osmotic? Osmotic. How about osmotic? And what case we use that? Thank you, doctor.
Okay. Usually, if you want like for patients, I use only the bulk fill composite for posterior. Like if you're going to use the flowable, definitely you cannot make your anatomy a good anatomy, because you know the flowable just flow, right? So what I usually do is I start with the flowable bulk fill, not the conventional, because the conventional flow composite, you can only use that for very, very thin layer compared with the bulk fill. So you use the flowable bulk fill, and then maybe 2 to 3 millimeters, especially if it's a deep seated. No, bulk fill composites are very good when you have a very deep seated cavity on the posterior. And then once you cure it, you have to have like 1 millimeter or one millimeter space for your conventional or your packable composite, in order for you to have a good anatomy of your occlusal surface of the posterior teeth. So you can either use a bulk fill sculptable, or you can use your conventional packable composites.
Yeah.
Did I answer your question right?
Yeah, thank you, doctor. Thank you so much.
Thank you.
Okay, thank you, Dr. Mylan. Maybe we finish the session because the time is up, and
I know.
it's already 10:27.
All right.
Okay, thank you very much. And ladies and gentlemen, we finally come to the end of the session. Before I give back to the MC, I would like to take the conclusion for what the speaker has presented. That composite is very aesthetic, but the key is polychromicity is the key for natural restoration. Okay, thank you very much, Dr. Mylan.
Thank you so much. Hope to see you soon after this pandemic. It's so hard, actually. Okay, thank you. Stay safe always. And it's nice to see you here, even though it's virtual. Okay, bye.
Bye,
Have a nice day. Okay, I leave now.
No, not yet, Dr. Mylin. Please wait, because there will be a certificate for you.
Oh, okay, can I have it?
Yeah.
Okay, Dr. Mylan, we say thank you for the informative and interesting presentation. It's very, very clearly for about restorasi composite. And thank you very much. I said Assalamualaikum warahmatullahi wabarakatuh. And Dr. Ratna Nurlia, the floor is yours.
Thank you, Dr. Nur. Thank you, Dr. Mile. Now, may I request Dr. Widya Saraswati, Dr. Gigi Magister Kesehatan, Spesialis Konservasi Gigi Konsultan, as a Head of Conservative Dentistry Department, Universitas Airlangga, to give certificate as an appreciation to our first speaker today, Dr. Milan Guevara Ikrube, DMD FPFA.
Thank you, Dr. Ratna. Hello, Dr. Mylin. Thanks for your coming again in Surabaya.
My pleasure.
Dr. Nastiti. So the certificate, please. Yeah. Please wait, Dr. Widya and also Dr. Mylin.
Yes. Fine, Dr. Mareta.
Okay. So maybe please wait. So Dr. Rere. Okay. Please wait. Dr. Rere.
Maybe the connection.
Yeah, please wait. So this is the certificate, Dr. Vidya.
Okay. Dr. Mylene, thank you for your sharing today. Thanks for inspiring sharing your case today, and I hope we can meet again in the future. Thank you. Please, Dr. Mylene.
Yes, it's my pleasure.
Okay.
Once again, thank you, Dr. Mylene. We hope we will meet you in the future.
And we can do maybe a workshop face-to-face.
Okay, so we can arrange for your workshop, Dr. Mylene.
Yeah, sure.
Yeah.
It's my pleasure.
Yeah,
All right.
Yeah, thank you very much, Dr. Mylene. Stay
Yeah.
safe and stay healthy.
Stay
Goodbye. Bye.
Stay healthy.
Okay, bye. Okay, now I do.
Selamat pagi, Dr. Trina.
Assalamualaikum
Waalaikumsalam warahmatullahi wabarakatuh. Alhamdulillah, nggih, monggo saya kembalikan pada MC.
Ya, terima kasih Dr. Mareta. Dan hadirin sekalian, kita memasuki sesi kedua. Sekali ini kita sudah bersama dengan Dr. Gigi Diatri Narirati, Magister Kesehatan, PhD, Spesialis Konservasi Gigi Konsultan dari Universitas Gadjah Mada. Beliau akan berbicara tentang Understanding Orifice Location for Improving Success in Endodontic Treatment. Masih dengan moderator yang sama, yakni Dr. Gigi Nur Hikmah, Spesialis Konservasi Gigi Konsultan dari Universitas Hasanuddin. Kepada moderator, Dr. Nur Hikmah, kami persilahkan.
Terima kasih, Dr. Ratna. Untuk sesi kedua akan dibawakan oleh Dr. Diatri Narirati dengan judul Understanding Orifice for Improving Success in Endodontic Treatment. Okay, before she begin the presentation, I would like to read the brief introduction of her. Name, Associated Professor, Dr. Professor Diatri Narirati, DDS, MDSC, PhD, Endodontist. Home address, Balai Mulia Residen, Yogyakarta. Office address, Faculty of Dentistry, Universitas Gadjah Mada, Yogyakarta, Indonesia. And education, 1988 Dentist, DDS, Universitas Gadjah Mada, Yogyakarta, Indonesia. 1998 MDS Postgraduate Study, Airlangga University, Surabaya, Indonesia. And 2006 PhD School of Dental Science, Faculty of Medicine, Dentistry and Health Science, the University of Melbourne, Australia. 2007 Specialist Study Program on Conservative Dentistry, Faculty of Dentistry, Universitas Gadjah Mada, Universitas Gadjah Mada, Yogyakarta, Indonesia. 2017 Consultant and Endodontist, Indonesian Collegium Conservative Dentistry. Work experience from 1993 to present lecture in undergraduate study program, Faculty of Dentistry, Universitas Gadjah Mada. From 2007 to present lecture in postgraduate study programs, specialist and master degree, Faculty of Dentistry, Universitas Gadjah Mada. And from 2014 to present lecturer in postgraduate study program, PhD degree, Faculty of Dentistry, Universitas Gadjah Mada. For position, I'd like to read her position. From 2007 to 2009, Secretary of Department of Conservative Dentistry, Faculty of Dentistry, Universitas Gadjah Mada. And 2016 to present Head of Conservative Dentistry Specialist Study Program, Faculty of Dentistry, Universitas Gadjah Mada. 2014 to present Assessor of Lampetekes. 2014 to present Evaluate of New Study Program in Indonesia. And 2016 to present Expertise Consultant of BPOM. Okay, that the curriculum vitae of the speaker for the second session. And for all the participants, if you have any question, please fill in the Q&A box. So, Dr. Diatri, it's around 45 minutes for your session, and the floor is yours. Please.
Okay, thank you very much for the Master of Ceremony. Actually, I prepare my presentation in Indonesian language because I asked the committee, especially Dr. Marita in that time, I have to prepare in Indonesian language. It's okay.
Tidak apa-apa,
Okay,
dokter.
but
Monggo.
no. I will present in Indonesian language because I didn't read. I'm not ready to present in English. Okay, but in my PowerPoint presentation, I read in English language. Okay, I will share the presentation. Let's try. Okay, sorry. Yeah. Can you see my PowerPoint presentation?
Yes, Dok.
Can you see?
Yeah.
Okay, thank you very much. I will start my presentation, but I deliver in Indonesian language. Topik hari ini adalah tentang understanding orifice location for improving success in endodontic treatment. Saya akan menyoroti ini dari minimally invasive endodontic approach. Oke, kita mengenal root canal orifice ya. Jadi saya akan membatasi di sini karena ini saya mendapat masukan dari panitia, terutama Dr. Marita di sini bahwa yang ikut kebanyakan S1 ini adalah untuk ranah S1. Sehingga menurut Ssk DGI itu adalah S1 itu bisa adalah mengerjakan sampai PSA gigi permanen saluran akar gigi jamak tanpa penyulit. Tanpa penyulit ini apa saja? Yaitu kalau didefinisikan tanpa penyulit itu tidak ada posisi gigi mudah dikerjakan. Jadi saya akan hanya sampai di molar 1 saja, baik anterior, mandibula ataupun maksila. Juga tidak ada popstone, saluran angkar bengkok tidak lebih dari 25 derajat. Itu akan saya batasi di situ, karena ini audiensnya kebanyakan adalah mungkin dari undergrad, ya dari. Oke, jadi root orifice itu adalah jalan atau pintu masuk menuju saluran akar dari kamar pulpa. Dan pertama yang harus dicari apabila akan melakukan perawatan saluran akar adalah orifice ini. Dan orifice ini meskipun mungkin sepele ya, it's just orifice ya, but ini sangat penting untuk keberhasilan suatu perawatan saluran akar. Jadi orifice itu adalah pintu masuk untuk ke saluran akar yang harus kita cari pertama kali. Nah, ini adik-adik, ini saya dari sisi endodontik ya. Jadi sekarang pendekatan untuk mencari orifice atau membentuk suatu cavity design untuk orifice adalah minimally invasive endodontic, dan minimally invasive endodontic ini merupakan breakdown dari minimally invasive dentistry. Mungkin partisipan di sini, audiens di sini sudah mengenal tentang minimally invasive dentistry. Dan ini yang endodontic ini merupakan the part of minimally invasive dentistry. Jadi tujuannya adalah mempertahankan maksimal dari struktur gigi yang sehat, mempertahankan struktur gigi yang sehat semaksimal mungkin. Oke, MIE ini adalah suatu konsep, adalah mempertahankan struktur gigi yang sehat semaksimal mungkin, baik dari sisi koronal, cervical, radikuler, ya, selama perawatan saluran akar. Jadi kesadaran kita atau kita harus membuat consideration ya, pertimbangan antara ini konsep perlu dipertahankan atau diperhilangkan, dieliminasi selama perawatan saluran akar struktur gigi tersebut, yaitu untuk memenuhi tujuan dari perawatan saluran akar dari endodontik. Jadi desain kavitasnya jelas kita harus mendapatkan suatu akses untuk instrumentasi dari saluran akar dengan mempertahankan sebanyak mungkin struktur gigi yang masih tersisa. Jadi ini adalah menghilangkan seminimal mungkin dentin saluran akar, terutama selama 3 fase preparasi, karena yang mengambil saluran akar, mengambil struktur dentin itu adalah selama preparasi, ya, yaitu preparasi bagian koronal, bagian radikuler maupun pembuatan flaring selama preparasi saluran akar. Saya akan menekankan hanya pada yang saya beri merah-merah di situ, yaitu yang pertama, yaitu coronal access preparation. Ini yang menentukan sekali untuk perawatan endodontik itu adalah akses suatu kavitas preparasi itu harus bisa memenuhi endodontic triad. Ya, endodontic triad itu adalah shaping and cleaning, terus sterilization of root canal using intracanal medicament, dan yang terakhir adalah obturasi saluran akar. Nah, jadi preparasi akses ini harus benar-benar bisa memfasilitasi dari cleaning and shaping until obturation of root canal. Nah, ini adalah the goal of the success of endodontic treatment. Ya. Dan cavity access ini harus bisa seperti tadi memfasilitasi, harus bisa penetrasi ke dalam, membuka, membentuk funnel yaitu suatu corong, dan membuka pulp chamber. Tapi harus diperhatikan konsep-konsep secara biologis, MIE, dan secara mekanisnya untuk membuat suatu akses kavitas untuk memulai perawatan saluran akas. But the most important thing is root canal system to be clean and fill in 3D dimension. Ya, 3D dimension ini dengan kata lain dari hermetis. Ya, kalau kita mengenal biasanya obturasi saluran akar harus dilakukan sehermetis mungkin. Ya. Oke, kita harus memperhatikan 3 untuk membuat suatu akses kavitas ya menuju saluran akar, yaitu operator needs, tooth needs, and restoration needs. Ya, for operator needs adalah condition the clinician need to treat teeth. Ya, ini juga berhubungan dengan skill dari operatornya juga, dan operator pun bisa melakukan shaping atau filing, ya, file tersebut bisa mencapai coronal dan sampai ke apical constriction dengan lurus, dengan mudah. Dan dari sisi tooth needs-nya adalah biological and structural limitation for a treated tooth to remain predictable functional. Ya, jadi keterbatasan secara biologis maupun struktur untuk merawat saluran akar. Jadi diharapkan gigi tadi bisa tetap berfungsi setelah dilakukan perawatan saluran akar. And the last is restoration needs, yaitu preparasi, bentuk preparasi dan kondisi gigi supaya bisa awet dan kuat, benar-benar kuat ke depannya. Oke. Nah, sekarang big aggressive canal flaring konsep itu ya sekarang banyak ditinggalkan ya. Adik-adik mungkin kalau masih koas mungkin sulit ya kadang-kadang mencari orifice ya, tapi dengan experience, dengan merawat beberapa pasien, kalau awal mungkin sulit ya beberapa pasien itu konsep ini yang besar gitu harus flaring, membuat yang sebesar-besarnya itu sudah mulai ditinggalkan. Ya, karena dulunya menurut pedoman kalau besar itu dapat meningkatkan instrumentasi di bagian apikal itu lebih bagus. akan mendapatkan diameter apikal lebih besar maupun bentuk taper yang kecil. Tapi sekarang ini lebih ke arah pendekatannya adalah lebih ke arah yang lebih kecil. Everything is small is beautiful, ya. Jadi apapun sekarang serba minimalis, ya. Rumah aja minimalis, ya. Tapi pekerjaan kita nggak boleh minimalis. Maksudnya hasil pekerjaan kita harus maksimal dengan keadaan yang minimalis, ya. Jadi yang sekarang lebih kecil, preparasi apikal lebih cukup, ya. Tidak usah sampai kemana-mana, cukup aja, dan akan preparasi continuous yang taper itu yang perlu didapatkan karena dapat meningkatkan kesuksesan dari root canal treatment. Terus endodontic design lebih ke arah biomimetic dan konservatif sekarang, ya. Ya, itu menghasilkan, ternyata menurut evidence based dentistry itu menghasilkan suatu gigi yang lebih kuat, ya, ke depannya setelah perawatan saluran akar. Dan tidak cukup bukti bahwa ternyata menurut evidence based dentistry tidak cukup bukti bahwa yang besar itu akan menghasilkan better seal, jadi penutupan yang lebih bagus, ataupun kegagalan perawatan endo yang lebih kecil itu belum tentu, ya. Dan root canal treatment ini kan menyorotinya adalah dari preparasi, karena preparasi di sini adalah yang mengambil struktur jaringan keras gigi yang paling banyak, itu adalah access preparation dan canal preparation, dibagi dua. Nah, ini kalau terlalu besar itu lebih mudah fracture giginya, ya. Jadi ada 3 aspek dari root canal treatment, yaitu dilihat dari biological success and survivability of tooth, ya. Jadi kesuksesan dari sisi biologis dari gigi tersebut maupun gigi tersebut survive, tidak fracture setelah perawatan saluran akar. Nah, ini yang penting di sini adalah menghilangkan mikroba, yaitu pada apikal 3 mili sampai 4 mili, ya, di saluran akar. Jadi kesuksesan suatu saluran akar itu yang utama adalah mikrobanya harus hilang, terutama di apikal 3 mili sampai 4 mili. Kemudian ada minimal removal of original tissue in the coronal 2/3 of root. Jadi pengambilan dari jaringan itu harus seminimal mungkin, terutama pada 2/3 koronal akar, sehingga meningkatkan survivability daripada gigi tersebut, ya. Kemudian ada akses ke root canal, itu sangat penting, terutama aksesnya yang koronal, ya, yang mencari orifice tadi, yang berhubungan dengan cavity design, maupun apikal. Kalau apikal di sini adalah perawatan root canal preparasi, root canal treatmentnya. Jadi mempertahankan integritas struktur gigi itu adalah merupakan key factor yang menentukan suatu prognosis. Jadi prognosisnya adalah apa? Prognosisnya adalah gigi tersebut berfungsi secara baik setelah dilakukan restorasi setelah perawatan saluran akar. Contohnya di sini ini sudah dilakukan obturasi saluran akar, selesai perawatan, dan dari sisi struktur gigi ini masih lumayan tersisa lumayan banyak juga di sini, ya. Nah, kalau di sini kita lihat, ya, banyak sekali pengambilan struktur gigi. Nah, ini banyak sekali, ya. Atau kadang-kadang kesalahan dalam mencari orifice sampai membuka kemana-mana, ya. Ini ada suara suara ya, mengganggu sekali. Terus di sini juga pembukaan yang terlalu banyak, ya. Ini akan terjadi apa, ya? Jadi yang penting, the most important thing is maintaining the structural integrity of the pericervical dentin, yaitu mempertahankan integritas struktur dari gigi tersebut, terutama pada PCD, yaitu pericervical dentin, yaitu 4 mm di atas dan di bawah alveolar crest. Ini contohnya pada gambar gigi molar. Gigi premolar maupun gigi anterior pun yang penting adalah di sini. Ya, ini merupakan memberi critical role untuk long-term survivability and optimum function. Nah, ini supaya apa? Supaya sisa struktur gigi tadi yang sudah diambil itu tetap kuat dan meminimalkan kelenturan daripada kaspel gigi. Ya, ini juga contoh yang terlalu besar, ya, ini bahaya sekali di sini. Nantinya bisa perawatan saluran akar berhasil mungkin, tapi long term survivability dari gigi mungkin dipertanyakan, ya, mudah fraktur di situ. Ini juga kesalahan-kesalahan tidak menemukan malah orifice, ya, jalan masuk menuju saluran akar. Ini juga terlalu agresif, terlalu besar, ya. Terusnya bisa dikurangi, ini bahaya di sini, ya, mudah patah ke depannya. Jadi sebaiknya adalah seperti ini, masih bisa lebih kecil, ya. Seperti ini, tidak usah mengambil struktur gigi yang banyak. Iya, memang ini diperlukan, sekali lagi diperlukan need experience of the operators, ya. Jadi mungkin adik-adik nanti kalau kepengen meneruskan ke spesialis, ya, bisa lebih spesialis konser, maksud saya ini sekalian jualan ini, ya, konser, SP konser ini. Saya 3 hari ini ke Unair terus ini, ya. Jadi kemarin 2 hari adalah sebagai asesor di SP konser Unair, ya. Sekarang juga, dan saya itu adalah alumni, cinta saya itu ke Unair itu karena saya alumni juga S2 di sini. Oke. Jadi kita akan menuju ke cara-cara mencari orifice-nya, ya. Ini merupakan pedoman dari laws, ya, hukum untuk anatomi dari pulp chamber yang gunanya adalah untuk mengetahui lokasi pulp chamber-nya, menentukan jumlah maupun posisi dari orifice pada dinding pulp chamber, pada dasar pulp chamber. Itu ada beberapa hukum di sini, mungkin adik-adik sudah diajar, ya, di S1-nya, yaitu ada Law of Centrality, Law of Concentricity, Law of CEG, Law of Symmetry 1 and 2, Law of Orifice Location 1, 2, and 3, and Law of Color Change. Oke, kita bahas satu-satu. Apa itu? Jadi yang pertama adalah Law of Centrality. Ini adalah panduan untuk memulai akses untuk mencegah perforasi mahkota ke arah lateral. Jadi ruang pulpa itu terletak di tengah gigi dan setinggi CEG. Ya, benar-benar di tengah tinggi dan setinggi CEG. Gitu. Sekarang ada Law of Concentricity. Ada dinding ruang pulpa itu adalah terpusat. Nih, di sini aja ini ilustrasinya. Terpusat atau terkonsentrasi di garis luar gigi pada tingkat CEG. Ini sama di sini, ya. Ini pas bagus sekali ya anunya, gambarnya, ya. Ini untuk apa? Untuk seberapa besar, ya, perluasan dari akses itu bisa dilakukan secara benar. Ya. Kemudian ada Law of CEG, yaitu jarak dari permukaan luar mahkota klinis ke dinding ruang pulpa. Itu adalah sama di seluruh lingkar gigi pada tingkat CEG. Ya. Terus ini adalah merupakan landmark yang paling konsisten untuk menemukan ruang pulpa. Jadi kalau kita masih bingung, ya, dengan molar 1 di sini adalah dengan probe ya, untuk mengetahui ini bagian lingkar luar permukaan luar mahkota klinis yang sama di seluruh lingkar gigi pada tingkat CEJ ke dinding ruang pulpa. Sekarang ada law of symmetry 1 dan 2, ini gunanya untuk menentukan posisi dari saluran akar dan kadang-kadang sering ya untuk menunjukkan bahwa adanya saluran akar tambahan yang kemungkinan tidak kita harapkan ada waktu itu, karena kita tahu kalau misalnya gigi molar 1, gigi premolar mandibula itu biasanya 1, tapi ternyata ada 2, atau gigi molar 1 itu biasanya 3 orifice-nya, saluran akarnya, tapi ternyata ada 4 ya. Jadi apa itu law of symmetry 1 adalah orifice memiliki jarak yang sama dari garis yang ditarik ke arah mesial distal melalui bagian tengah dasar ruang pulpa. Ini kita menarik garis di sini adalah sama ke arah mesial distal. Ya, ini enggak. Kemudian ada law of symmetry 2 adalah orifice terletak pada garis tengah tegak lurus dan garis yang ditarik ke arah mesial distal melalui bagian tengah dasar ruang pulpa. Adalah untuk menentukan posisi saluran akar yang tepat dan sering menunjukkan adanya saluran akar tambahan yang tidak terduga. Nah, ini kita tegak lurus dari garis yang kita tarik mesial distal tadi. Terus ada juga, ini menunjukkan tadi adalah kadang-kadang kita bisa menemukan berdasarkan law of symmetry tadi ada saluran akar tambahan ya, orifice-nya tambah 1 di sini ya, karena ini apa? Ini tidak exactly in the middle ya, tidak benar-benar di tengah, tapi agak ke arah mana ini mesial, ke arah lingual, sehingga harus kita harus mulai berpikir ini tidak benar-benar di middle, ini mesti ada sesuatu di sini. Mungkin kalau diilustrasikan adalah kemungkinan ada orifice tambahan atau saluran akar tambahan di sini ya. Dan ini kalau ditarik garis agak melenceng ke sana adalah di sini kira-kira orifice-nya. Oke, sekarang ada law of color change, yaitu warna dasar ruang pulpa adalah lebih gelap daripada dinding ruang pulpa. Ya, mungkin kalau adik-adik sudah pernah mendapatkan dasar ruang pulpa itu selalu lebih gelap ya daripada dinding ruang pulpanya. Ya, ini biasanya untuk sebagai pedoman untuk menentukan apakah akses tersebut sudah benar-benar selesai, sudah cukup ya, dan akses yang cukup itu harus bisa memperlihatkan dasar ruang pulpa, pulp chamber bisa terlihat seluruhnya ya. Kemudian ada law of orifice location 1, 2, and 3. Ini gunanya adalah untuk mengidentifikasi jumlah dan posisi dari orifice gigi. Ya, ada orifice. Apa sih law of orifice location 1 itu? Yaitu orifice itu terletak di persimpangan dinding dan dasar ruang pulpa. Ya, ini dan dinding dan dasar dinding ruang pulpa dan dasar ruang pulpa. Kemudian yang kedua adalah orifice terletak di sudut persimpangan dinding dan dasar ruang pulpa. Jadi di sini ya. Dan kemudian yang ketiga adalah orifice terletak di ujung garis pertemuan perkembangan pulpa. Perkembangan akar ya, kalau kita mencari orifice kadang-kadang kalau dengan membuka atap pulpa akan terlihat ini developmental function line ya. Jadi dinding pertemuan perkembangan akar. Jadi kalau kita melakukan spesimen ya, mungkin gigi yang telah dicabut kita potong, menunjukkan ini ada mempunyai 4 saluran akar di sini ya, ada 4 orifice di sini karena semuanya tidak satu di sini tidak benar-benar di tengah kalau ditarik garis mesial distal tadi. Ini juga ini mesti ada saluran akar tambahan karena agak melenceng. Untuk gigi premolar ya ini ada biasanya 2 saluran akar tapi kalau ditarik dari bukal ke lingual ini juga melenceng ya, jadi kemungkinan ada tambahan 1 saluran akar di sini ya. Kemudian kalau gigi molar itu benar-benar kalau ditarik itu benar-benar di tengah loh kok di sini ketemu, di sini juga ketemu. Nah, ini tidak harusnya kan ditegak lurus dengan garis mesial distal, tapi ini benar-benar di tengah garis yang kita tarik dari mesial distal, sehingga asumsi kita ini mesti hanya 2 saluran akar. Oke, kita akan secara cepat ya ini karena adik-adik mungkin sudah mengerti ya, jadi open access di sini untuk mencari orifice pada gigi anterior maxilla, yaitu biasanya ini banyak kekeliruan yang baru saja mungkin di scalp ya, nyari orifice pun tidak ketemu-temu ya, yaitu harus benar-benar tepat di atas cingulum daripada gigi tersebut ya untuk gigi anterior maxilla. Jadi posisinya harus tegak lurus, kemudian secara lurus masuk dulunya tegak lurus tumbuh gigi, kemudian lurus. Adik-adik akan merasakan bor yang dipegang adik itu akan terasa masuk ke suatu lubang, jadi jatuh ke suatu lubang. Itulah orifice. Adik sudah menemukan partisipan di sini sudah mulai menemukan orifice kalau sudah jatuh seperti itu. Ya, tinggal menghilangkan obstruksi-obstruksi di sini supaya file bisa lurus masuk ke dalam saluran akar. Ya. Selanjutnya ini gigi incisivus maxilla sentral ya, itu bentuknya adalah trianguler untuk gigi yang muda ya. Kenapa trianguler dan ini harus bentuknya seperti ini? Karena kita tahu tanduk polpa itu kalau gigi anterior maxilla dan mandibula adalah benar-benar di mesial dan distal, sehingga tanduk polpa yang ada berisi juga polpa, kalau jaringan tersebut nekrotik harus benar-benar terambil, karena kalau tidak terambil akan menimbulkan diskolorasi pada gigi tersebut. Dan karena posisi lokasi dari tanduk polpa adalah di mesial distal, sehingga bentuknya adalah trianguler, segitiga terbalik di sini. Tapi semakin tua karena terbentuk dentin sekunder ya. Dentin sekunder itu kan dibentuk oleh seseorang itu sepanjang hidup. Jadi kalau orang yang muda mungkin bentuknya seperti ini untuk akses ke saluran akarnya, tapi kalau untuk orang yang tua, lebih tua adalah bentuknya oval. Kemudian incisivus lateral hampir sama seperti ini ya, trianguler dan oval. Kemudian canine caninus maxilla itu lebih ke arah oval seperti ini bentuknya ya. Untuk dan biasanya apa yang sering terjadi kesalahan-kesalahan, yaitu memasukkan tadi yang tegak lurus dengan sumbu itu terlalu masuk ke dalam. Nah, ya, ini bahaya sampai bisa menembus ke labial, dan pengambilan struktur gigi terlalu banyak ini ya, yang akibatnya apa tadi? Nanti ke depannya mungkin untuk restorasi tadi PDC-nya kan banyak yang hilang ya, sehingga apa? Sehingga mudah fraktur gigi tersebut kalau sudah selesai perawatan saluran akarnya. Dan juga terbentuk shipping juga, dan ini adalah panduan untuk gigi mandibula anterior ya, sama seperti itu, tegak lurus dulu, kemudian kemudian sejajar dengan sumbu gigi. Selanjutnya ini incisivus mandibula ya, bentuknya agak triangular juga. Pada gigi yang lebih tua adalah oval. Kemudian ini adalah caninus mandibula, persis dengan yang maksila tadi adalah oval juga, dan ini biasanya yang kesalahan dalam mencari orifice ya, seperti tadi terlalu banyak yang diambil sampai masuk ke dalam ya, ini juga akibatnya ya, ini juga bahaya sekali kalau sampai melengkung seperti ini, yaitu tidak mendapatkan akses yang lurus, ini akan patah instrumen filenya. Dan ini adalah guidance untuk mandibula premolar ya. Ini benar-benar terletak di tengah. Jadi pertama adalah ditujukan ke tengah mahkota, ya seperti itu. Terus tinggal menghilangkan obstruksi sehingga bisa didapatkan lurus dari koronal ke arah konstriksi apikal. Ini adalah pandulan untuk premolar mandibula pertama. Ini ya, ini sebetulnya paling mudah ya, premolar itu mengerjakan premolar itu untuk mencari aksesnya, karena tinggal lurus dan pandangan gigi tersebut mudah dilihat, divisualisasi oleh operator. Jadi kalau ini ada yang satu orifice-nya, kadang-kadang ada yang dua, tapi bergabung nanti saluran akar di sepertiga apikal. Tapi ada yang satu, tapi kebanyakan adalah satu, ya. Kemudian yang cycle premolar ini bisa dua atau satu seperti ini. Satu dari koronal sampai konstruksi apikal. Kemudian ada juga yang terpisah di sepertiga apikal. Ya, dulunya dua, orifice-nya jadi satu, tapi di 2/3 koronal di sepertiga apikal akan terpisah. Itu ada yang seperti itu. Ya, dan biasanya error yang terjadi ini kalau ada kavitas atau karies yang menyebabkan gigi tadi nekrosis, itu biasanya jangan sekali-sekali memasukkan file dari sini, membuat akses kavitas dari sini. Ini harus tetap dari koronal, ya. Di sini sebaiknya ditutup ya, supaya tidak ada kontaminasi dari cairan saliva maupun cairan mulut. Jadi ini untuk sementara ditutup dulu, bisa dengan kavit atau bisa dengan glasionomer semen ya. Terus kita tetap open aksesnya dari arah koronal sehingga mendapatkan garis yang lurus ya. Kemudian ini untuk mencari mandibular orifice ya, ini bentuk tadi segitiga ya, ini yang paling besar adalah yang sisi distal saluran akarnya, sehingga biasanya kita mencari yang pertama adalah di sisi distal dulu, baru kemudian ke mesiobukal dan mesiolingual. Mesiolingual yang paling kecil ya. Begini terus mendapatkan garis lurus dan diharapkan di sisi sini pericervical dentin tadi tetap dipertahankan. Kemudian ini molar mandibula pertama ya, bentuknya seperti tadi ya, pas sekali kalau kita tarik mesial distal, kemudian ada tegak lurus dengan garis mesial distal, itu adalah seperti ini. Tapi kadang-kadang ada yang agak bentuknya segi empat dengan dua saluran akar, dua orifice di daerah distal, yang biasanya hanya satu. Ini bentuknya agak ke arah segi empat. Kemudian kesalahan-kesalahannya yaitu terlalu besar pembukaannya ya, bahaya sekali terutama di PCD di sini ya, dan tidak menemukan orifice ternyata malah, atau terjadi perforasi ke ke daerah sini ya. Terus juga perforasi kemana, atau kurang pembukaannya kurang seperti ini, karena ini kurang harusnya agak ke tengah sedikit. Kemudian next-nya adalah open access untuk gigi posterior maxilla ya, ini gigi P premolar ya itu diletakkan benar-benar di tengah. Pertama buri yang kita masukkan, ya kalau gigi anterior premolar maksila yang pertama itu biasanya 2 saluran akar, sehingga orifice-nya pun ada 2 di sini, ya. Tapi ada yang terpisah seperti ini, ada yang kemudian terpisah kemudian nyambung. Ini biasanya 2, ya. Jarang yang 1. Tapi kalau premolar maksilare kedua maksila itu bentuknya kadang-kadang malah banyak yang akarnya bayonet seperti ini, ya. Dan biasanya kadang-kadang ada yang 1, ada yang 2 orifice-nya, ya. Jadi saluran akarnya ada yang 1, ada yang 2. Kalau 2 biasanya akan terpisah di pertengahan. Kemudian kesalahan-kesalahannya sama, ya ini tidak menemukan, tapi preparasi pembukaannya sampai mana-mana, ya. Terus juga bisa terjadi perforasi dan sebagainya. Kemudian molar maksila gigi ini yang paling sulit kalau untuk endodontis, ya. Saya paling sulit, paling nggak seneng kalau merawat gigi molar maksila ini, ya. Molar 1, molar 2, ya. Paling senang adalah premolar 1, terus molar, ya, dan anterior gigi. Ya, ini paling nggak senang karena apa? Karena sudah sulit aksesnya kadang-kadang, ya. Nanti kadang-kadang juga variasi lokasi orifice itu juga banyak di sini. Jadi yang paling besar adalah kalau maksila adalah di palatal. Jadi pertama yang bur kita arahkan untuk mencari ke palatal gigi dulu, orifice yang daerah palatal gigi. Kemudian baru dilebarkan, dibuka atap pulpanya. Kalau ini molar pertama maksila, ya seperti ini, bisa bentuknya seperti ini dan juga segitiga seperti ini, ya. Ini di palatalnya, tapi kadang-kadang ada tambahan di sini, ya, saluran akar kecil, ya. Kemudian ada yang mesio bukal maupun disto bukal, juga mesio dan disto, tapi agak miring segitiganya. Dan ini ada kesalahan-kesalahan, ya. Ini seperti tadi juga perforasi ke arah bifurcatio, ya. Dan ini kurang preparasinya. Kadang terus filenya melengkung, tapi dipaksakan lama-lama bisa patah. Oke, concluding remarks, ini pas 45 menit dari saya adalah perawatan saluran akar menggunakan MIE approach itu adalah memaksimalkan, mempertahankan struktur gigi yang sehat semaksimal mungkin. Jadi jangan mencari orifice pun sampai kemana-mana tidak ketemu, sehingga bisa mengambil jaringan sehat daripada gigi. Itu merupakan tujuan utama untuk mencapai kesuksesan dari perawatan saluran akar. Jadi seorang klinisi nantinya harus mempunyai pengetahuan yang benar-benar dalam mengenai anatomi dari saluran akar maupun gigi, terutama dalam mencari orifice, ya, pada setiap gigi. Itu awal dari kesuksesan. Meskipun ada kesuksesan root canal treatment itu tidak hanya didasarkan pada pencarian orifice saja, but this was the first step to achieve the success of root canal treatment. Oke, terima kasih. Thank you. The more we keep, the longer we keep the tooth, and removal of as little as necessary of tooth structure. Terima kasih. Saya kembalikan ke Master of Ceremony. Silahkan. Saya stop sharing, ya.
Terima kasih banyak, Dok, atas materinya yang sangat menarik dan sangat applicable tentunya, karena yang bisa kita simpulkan bahwa akses opening ini sangat mempengaruhi atau merupakan salah satu kunci keberhasilan dari perawatan endodontik yang akan kita lakukan. Nah, kita masuk ke sesi selanjutnya, yaitu sesi Q&A. Silahkan, mungkin ada yang ingin langsung bertanya kepada pemateri, Disilahkan. Oh, jika ingin peserta yang ingin.
Selamat pagi, dokter sekalian.
Selamat pagi.
Silahkan.
Mohon izin bertanya.
Iya,
Perkenalkan,
silakan.
nama saya Michael Raharja dari FKG Unair Angkatan 2018. Terima kasih banyak Dokter Diatri atas pemaparan materinya yang sangat membuka wawasan. Dan di sini saya ingin bertanya, Dokter, kalau tadi dijelaskan mengenai access opening, setahu saya setelah dilakukan prosedur access opening, maka akan dilanjutkan dengan prosedur glide pad. Nah, saya ingin bertanya untuk prosedur glide pad sendiri ini, bagaimana untuk prosedurnya, dan untuk prosedur glide pad ini sendiri, apa kriteria dari prosedurnya sehingga dikatakan bahwa glide pad ini bisa selesai dan juga bisa dilanjutkan ke tahap berikutnya. Terima kasih, dokter.
Oke, langsung dijawab atau bagaimana?
Silakan,
dokter. Oke.
Langsung dijawab saja.
Terima kasih ya. Ini sebetulnya saya itu fokusnya di access opening atau mencari orifice, but it's okay. Ya, saya akan jawab untuk glide pad-nya. Jadi memang kalau pertama sudah ditemukan orifice ya, dan jalan masuk menuju saluran akar tadi sudah ditemukan, kita dengan pelan-pelan memasukkan, jangan dengan aktif memasukkannya, pelan-pelan. It's slowly is better, ya, dengan suatu file yang kecil, ya. File yang kecil ini ukuran berapa? Kira-kira bisa 8, bisa 10, atau dari kecil dulu 6, pelan-pelan masuk. Dan dengan gerakan watch winding, tapi watch winding-nya jangan kasar ya, pelan-pelan watch winding untuk mencari glide path sampai jadi tujuannya adalah exploring, ya, exploring daripada saluran akar. Apakah benar-benar tidak ada obstruksi di situ, ya. Terus selanjutnya kalau sampai 6, dicoba lagi 8, pelan-pelan, kan sudah ada jalan masuk tadi juga. Kemudian 10, kira-kira dengan file 10. Ya, kalau memang sudah bisa tercapai, tidak ada obstruksi, atau kita bisa merasakan tactile kita ya dengan tangan kan itu ya, karena glide path tidak ada prosedur glide path ini tidak ada yang dengan rotary, selalu dengan tangan. Jadi kalau semakin experience seseorang itu akan merasakan tactile-nya. Oh, ini sudah masuk, sudah kira-kira sampai ke apical konstriksi dari saluran akar tersebut. Ya, itu sudah dinyatakan selesai. Dan selanjutnya adalah preparasi saluran akar dulu ya. Ya, tapi sebelum preparasi saluran akar harus dihitung dulu panjang kerjanya atau panjang kerja yang tentatif dulu. Tergantung mau pakai yang metode crown down atau step back gitu ya. Begitu. Tujuannya memang exploring itu dulu ya, glide path itu. Begitu dokter ini mahasiswa S1 ya Michael ya, selamat belajar, semoga sukses nanti ya. Oke.
Amin, terima kasih banyak atas pemaparannya Dokter Diatri.
Ya. Oke, masih ada waktu, sedikit waktu. Kalau misalnya masih ada ingin bertanya ke pemateri, boleh langsung. Atau misalnya ada yang ingin menuliskan di Q&A box, boleh dok, silahkan. Atau adik-adik mahasiswa. Selagi pemateri kita masih ada, silahkan. Sepertinya atau bagaimana? Sepertinya dok sudah.
Oke, nggak apa-apa.
Pertanyaannya sudah selesai atau bagaimana, masih ada yang bertanya? Alhamdulillah masih ada waktu, masih ada sedikit waktu, masih ada 5 menit nih. Baik dok.
Mungkin Dokter Nana lagi, sepertinya Dokter Nur Hikmah sudah mau tanya itu Dokter Nana.
Dokter Nana siapa ya tadi?
Iya, Dokter Nana.
Gimana kabarnya Dokter Mareta ini ya, kemarin nggak ketemu.
Iya, alhamdulillah dokter saya baik dan sehat.
Ya.
Dokter G. Monggo Dokter Nana, kemarin MC-nya konservasi dok.
Oh, yang MC-nya konservasi cantik-cantik, bagus-bagus.
Iya,
MC-nya kemarin ya, benar saya appreciate sekali.
Monggo Dokter Nana, silakan.
Ya dokter, selamat pagi Dokter Diatri.
Oh, kemarin pakai ini soalnya pakai masker, iya nggak kelihatan.
Sosialisasi di kampus, dokter.
Nggak capek kemarin
sudah di rumah.
ngomong terus ya puasa-puasa.
Iya, dokter. Dokter, saya ingin bertanya mengenai akses opening mungkin ya, dok ya, lebih ke akses opening yang selama ini kita pelajari, mungkin juga di teman-teman S1 waktu kita dulu belajar S1, mungkin MIE itu ya, dok ya, kita harus lindungi sebanyak mungkin yang jaringan sehatnya. Namun beberapa waktu ini kayak banyak yang itu loh, dok, kayak banyak yang case yang mulai populer mengenai minimally invasif seperti jalan masuk yang mungkin apa ya, dok, kadang-kadang kayak disebutnya kayak ninja,
ninja atau
akses,
trust,
ya
gitu.
begitu. Itu dokter boleh nggak dibagikan kira-kira bagaimana sih dokter Diatri mengenai case-case seperti ini sebenarnya gitu, kalau misalnya dilakukan pada pasien-pasien itu mungkin baiknya kita tuh indikasinya apa atau hal-hal yang perlu diperhatikan gitu, kira-kira kapan kita bisa menggunakan ini kalau kita sudah mahir nanti begitu, dokter.
Iya.
Terima kasih.
Dokter Nadia ya.
Iya, Nana, dokter boleh panggil Nana.
Dokter Nana, ini baru SP ambil residen, jadi residen atau sudah lulus?
Iya, saya baru residen, baru semester 1 ini, dokter.
Baru semester 1, oke ya. Memang ya sekarang banyak yang, bukan banyak ya, ada pendekatan secara ninja ya, mungkin adik-adik nggak tahu. Ninja itu hanya, jadi kadang-kadang kalau gigi premolar itu hanya cukup langsung masuk ke saluran akarnya, tidak perlu bentuk segitiga tadi ya, segitiga yang puncaknya adalah di distal. Saya memberi gambaran ya, kalau gigi molar pertama mandibula itu adalah di distal, terus mesiobukal dan mesiolingual. Nah, kalau ninja itu tidak tapi langsung, jadi tidak dihubungkan nanti akhirnya menjadi menjadi sambung tadi, tapi cukup di distal itu kita lakukan perawatan. Di mesiobukal kita lakukan perawatan. Ya, ada yang bilang ini cara trust kalau nggak salah ya, TRUSS ya. Nah, itu kalau selama memang mikroba tersebut ya, semua kan kembali ke mikroba ya, ke mikroorganisme, bisa terambil banyak dan tidak berkembang biak lagi, nah itu bisa berhasil. Tapi saya kadang-kadang pesimis dengan hal itu, ya, karena kadang-kadang daerah pulp chamber itu benar-benar harus dibersihkan juga, tidak hanya di saluran akarnya, ya, mikroba itu ya. Kalau dengan tidak menghubungkan itu kan terus pulp chambernya kadang-kadang tidak maksimal penghilangannya. Ya, tapi dari struktur giginya benar-benar minimal pengambilannya. Ya, ini benar-benar kontroversial ya pendekatan ini ya. Kalau saya menyarankan sebaiknya minimal tapi tidak model secara ninja, ya, karena menurut evidence based dentistry adalah mikroba itu masih banyak kalau secara ninja tersebut, ya. Begitu dari saya, Dokter Nana, sampai ketemu ya.
Iya, dokter.
Siapa tahu ujian kompre saya yang menguji.
Atau ujian kompetensi ujian saya ya, dokter.
Iya.
Luar biasa nih, berarti istimewa, dokter, untuk Dokter Nana ini.
Sudah perkenalan duluan.
Jujur ini untuk saya ada istilah ninja ini kok ya seperti mengerikan gitu ya, dok ya.
Iya, itu memang dari Clark dan namanya Clark dan siapa tadi lupa saya, akademi kelihatannya penemunya itu ya. Ya.
Mungkin dari Bukadap konservasi atau Pak KPS ini konservasi sudah mesem ini Dokter Trina.
Sekarang saya ditanya, kemarin saya banyak menanya.
Nah, sekarang gantian kan Dok ya.
Tanya.
Untuk gantian nanya sama Dokter Trina ini.
Nggak berani Mareta, nggak berani, ampun.
Bukadap itu suruh istirahat tok sama Pak Kaprodi, capek tuh 2 hari habis itu. Asesori kok nggak istirahat aja. Nggak usah lihat, saya bilang nggak usah lihat saya, istirahat aja.
Iya, seneng rawuh lagi ya Dokter Diatri.
Iya, saya paling sayang ini pada Unair karena juga alma mater saya ya, jadi hati saya itu bagian UGM, sebagian Unair ya.
Nggih, matur nuwun sudah sharing hari ini. Monggo Dokter Mareta, sampun.
Anu Dok ya, hatinya Dokter Trina terpatri untuk Unair juga ya Dok ya?
Iya, jelas alma mater saya.
Baik, mungkin waktunya bagaimana moderator?
Sudah selesai Dok, Alhamdulillah waktunya sudah cukup. Terima kasih banyak Dokter Diatri atas materinya yang sangat menarik dan pasti sangat applicable untuk kita semua, terutama untuk saya pribadi. Baik Dok, terima kasih banyak atas presentasinya dan saya kembalikan ke moderator. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Waalaikumsalam warahmatullahi wabarakatuh. Balik Dokter Hikmah ke MC kan?
Oh iya, ke MC Dok, maaf ya.
Silakan.
Silakan Dokter Ratna.
Terima kasih Dokter Nur. Efek puasa ya Dokter. Baik, ya selanjutnya adalah penyerahan sertifikat yang akan diserahkan oleh koordinator program studi dari Departemen Konservasi Gigi Fakultas Kedokteran Gigi Universitas Airlangga kepada pembicara. Untuk itu kami persilahkan kepada Dr. Gali Sampurno, Dokter Gigi Magister Kesehatan, Spesialis Konservasi Gigi Konsultan, untuk dapat memberikan sertifikat kepada pembicara kedua, yakni Dr. Gigi Diatri Nariratih, Magister Kesehatan, PhD, Spesialis Konservasi Gigi Konsultan.
Ya, terima kasih Dr. Trina. Kita berjumpa lagi setelah 2 hari berturut-turut.
Semoga nggak bosen ya dengan saya.
Iya, tidak Dokter. Ini kami sampaikan sertifikat dari acara Stovit Online Series 2021. Semoga Dr. Diatri berkenan dan ini adalah sebagai speaker. Terima kasih.
Ya, terima kasih kembali Dr. Gale ya, semoga teman-teman di konser maupun di Prosto ini yang baru juga saya asesori ini tidak bosan semua dengan saya ya. Nah, ini juga yang tanda tangan Pak Roslin ini, Dr. Roslin ini kemarin juga 1 minggu sebelum Unair saya ke sana juga ke prodinya Dr. Roslin ini. Ke Unhas juga
untuk
saya.
bedah mulut ya Dok ya?
Ya, untuk bedah mulut juga saya ke sana untuk menjadi asesor. Ya, terima kasih. Semoga berkenan dengan sharing saya ya. Saya saya persiapkan di tengah kesibukan. Nah, seminggu ini asesor terus 2 minggu ini asesor terus maupun klinik lampetikes. Terima kasih. Mohon maaf kalau ada kesalahan-kesalahan dari saya yang disengaja maupun tidak disengaja. Terima kasih. Saya mohon pamit ya.
Baik.
Ada acara.
Terima kasih banyak.
Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Terima kasih.
Sampai ketemu.
Terima kasih.
Baik, kita memasuki sesi ketiga. Untuk Mr. Yoko Suzuki sudah bergabung ya, Dr. Mareta?
Sudah sepertinya. Good morning, Mr. Yoko. Ohayo gozaimasu.
Good morning.
Ohayo gozaimasu. Genki desu ka?
Arigatou gozaimasu.
Sudah silakan, Dr. Ratna.
Ladies and gentlemen, in this last session we have Mr. Yoko Suzuki. He will talk about importance of daily handpiece maintenance and introduction of multiple unique design handpiece. And this session will be moderated by Dr. Gigi Nur Hikmah. Dr. Nur, time is yours.
Thank you, Dr. Ratna. And finally, we come to the last session of the Stovit online series today. And for the third session, it's gonna be delivered by Mr. Yoko Suzuki and Nsk Singapore. And for this session, he would like to present his paper with the title Importance of Daily Handpiece Maintenance and Introduction of Multiple Unique Design Handpiece. Before he delivers his presentation, I would like to read a brief introduction of him. For personal information, name Yoko Suzuki, nationality Japan, date of birth 18 May 1988, and address Nsk Nakanishi, Asia, Singapore. For academic background, 2007, Cheltenham Secondary College, Australia, and 2008, Queensland Institute Business Technology, Australia, and 2012, Griffith University, Bachelor of Aviation and Flight Management, Australia. For qualification, Ausspracher 2008, English Proficiency Test Level 6, and 2010, Private Pilot License on Australia, 2012, Commercial Pilot License, CASA, Australia, and 2012, Pass Ireland Transport Pilot License Theories Exam. That's the curriculum vitae of our speaker today. And for Mr. Yoko Suzuki, please, the floor is yours.
Okay, thank you very much, Doctor. Yes, so my name is Yoko Suzuki. Good morning, everyone, and thank you very much for joining. And thank you for the quick introduction about myself. Yes. So actually, my background is aviation. I was previously a pilot, not working for the industry. Yes. But now I've been working with the NSK, working for dental industries more than 6 years. And now I'm more into this field. Okay, so thank you for this opportunity today. And let me start share you the screen for today's topic. Okay. Okay. Okay, so I'm from NSK Asia, Singapore office. I'm in charge for sales and after service for whole Southeast Asia market, okay, including our Indonesia market. Okay. So I believe our doctors already know about NSK very well. NSK is a dental company, dental instruments company, and very popular with the handpieces. Okay. And apart from handpieces, we are also making, for example, implant motors, scalar handpieces, laboratory micro motors. Okay, so this is a kind of our part of our NSK products. Okay. NSK is a Japanese company, okay, located in Japan. Okay. And when you hear about Japan, maybe you might first imagine like animations like Tokyo, lots of the shopping areas in Tokyo or something like this. Okay, but NSK factory is located not in Tokyo. It's out of Tokyo, about 2 hours from the capital of Tokyo, called Tochigi Prefecture. So it's more like countryside. Okay, we have the factory and the main office. Okay, so this is nothing like Tokyo, but this is in Japan. Okay. So the good thing is that we can concentrate on working and producing NSK, the products. Okay, concentrating on the production and making quality products in Japan, okay, at the countryside. But it's a very beautiful view, as you can see. Many mountains. Okay, very good environment, working environment. Okay. And now Japan is a spring season, so you can see like cherry blossoms, okay, like this, just behind the factory. It's the backyard of the factories. Very nice view. Okay. So located in the mountainside, okay, in Japan. NSK is a very historical company, okay, established in 1930. So this is one of the oldest dental company in the world, actually. Having now currently 91 years old of the experience of the producing dental instruments. Okay. And very popular, very famous company in all over the world. Everyone knows NSK. Everyone, all doctors know about Nsk Handpieces. And in fact, we have, there are 15 overseas subsidiaries, offices globally. Overseas 15 offices available for NSK company. And we have almost 135 dealers who are selling our Nsk products all over the world. And we are still leading as #1 handpiece global dental instruments company. So this is the Nsk Head Office. Okay. Looks like this factory. This is the factory also. Very big factories, 14,000 square meters. Okay. And inside the factory looks like this, and operating 24 hours, 7 days, non-stop, producing every day for sending our our dental instruments to all over the world. Okay. So Nsk products, including handpieces, everything's made in Japan. Okay, this is a Japanese company. Okay. So now here's today's main topic. Okay. So I selected these 2 topics for today. #1 is introduction of Nsk handpieces. Just a quick introduction about Nsk handpieces for the student doctors. Okay. So I'd like to introduce the student kit and also advanced handpieces. Okay. And the second topic for today is the importance of the daily maintenances. Okay, because the maintenance is very important. Things you have to follow, you have to do it every day, okay, to maximize the lifetime of the handpieces. Okay. And at the end of this presentation, I'd like to give you some quizzes. Okay, so this presentation will be it takes about 1 hour, 1.5 hours. But please try to get as much as details, and please try to answer to my quizzes at the end of this presentation. And if you give me the right answers, you may get the special gifts from Nsk this time. Okay, so please listen to this very carefully. Okay. So first of all, I'd like to show you this student kit. Okay, this is a student kit. It's called student kit, including with the necessary handpieces for you to use it for your daily, daily study in the university. Okay, and currently Nsk is collaborating with the Sanrio company. The Sanrio is the company making the Hello Kitty. So this is official. Okay, officially we are collaborating with the Hello Kitty company. Okay, and if you buy this student kit, you will receive this Hello Kitty carry bag for free of charge. It's like a package now. Okay, so if you like Hello Kitty, maybe it's a good opportunity for you to choose this student kit. Okay, but not only for this Hello Kitty. Our handpieces has lots of features, lots of advantages, which I will explain to you now. Okay, so what is student kit? What is including? Which handpieces are including in the student kit? Okay, so in the student kit, you will get air motor, okay, low speed contra-angle handpiece, okay, and straight handpiece, and high-speed air turbines. Okay, so these are the basic package contents, which is including in the student kit. Okay, you can also select from this. So in the student kit, you will receive straight handpiece, air motor, okay, and you can select either from push button low speed handpiece called FX23 or wrench type contra-angle handpieces. Okay, and if you select push button type contra-angle handpiece, okay, automatically you will receive this push button type high speed turbine handpiece. Okay, so like package, straight handpiece, air motor, push button, and push button turbine. Okay. If you select this FX22 wrench type, okay, handpiece, you can select from push button type or wrench type handpieces. Okay? So it's selective, optional selection. Okay? So this is the basic contents of the student pack, student kit. Okay. Okay. So I would like to show you the mechanism, the differences between air turbine and low speed counter-angle handpieces, because it's better to know this. Later on, I will explain you about maintenances. Okay, so when it comes to maintenances, if you know these mechanisms, maybe you can get more ideas what I'm talking about, why it is important to do proper maintenances for different designed handpieces. Okay, so air turbine handpieces, very basic, okay, very simple design. The air enters into the handpiece and rotates the cartridge. This is how it works. It's air-driven systems, okay? Air to rotate. Contra-angle handpieces, including the low speed handpieces. Okay, this is not like turbines because these handpieces consist from gears, cartridge, middle shaft, and dog clutch. And usually, it's made by 3-gear systems: cartridge, neck, middle shaft, and the dog clutch. Okay, so these are different. Okay, and okay, the purpose of handpieces for student pack, student kit. Okay, so as I said, you will receive high-speed turbine handpieces, so you can mainly use it for cutting purposes, cutting or trimming and so on. Okay, and low-speed handpieces, which is straight handpieces and the wrench type handpiece or push pattern type 1-to-1 slow-speed handpieces, mainly using for finishing, trimming, and polishing. Okay. Okay. So when you are choosing, if you are planning to buy new handpiece, how do you choose the brand? Okay. Maybe you're looking at, of course, cost first, price. Okay. You want to get something very reasonable price. Okay. And you don't want to get too much stress when you are operating patient. Okay. So you want to get something you can cut easily, sufficient cutting power. Okay. And you're looking for very durable, strong handpieces, okay, and comfortable to use, less stress. Okay? So on the market, there are many different brand, different handpieces you can find on the market. Okay, but when you choose handpieces, I would highly recommend you to choose something with the advanced structural design for safety purpose, as well as for you to use more comfortable usage. Okay, so I would say Nsk is one of the best option. Okay, for you to choose if you are planning to buy new handpieces now. Okay, so let me introduce our Nsk handpieces today. Okay, so why Nsk handpieces? Because of high precision work, it's made in Japan. Nsk in-house made, everything is made in Japan. Advanced structure technology, durable, very durable handpieces and very powerful handpieces. Okay, and also advanced infection control systems. Maybe this is very important topic, especially at this time because of the COVID. COVID and many doctors concerns about the infection, the risk of infection. Okay, so I'd like to explain about these features, okay, the products. Okay, so first, FX series. So FX series, as I said, this is the model, including in the student package for straight handpieces, slow speed handpiece, contra-angle handpiece, and air mortars. So these models are called FX series, okay, including in the student package. Okay. So the features of this low-speed handpiece, FX23 push pattern and FX22 wrench type. Okay. So these are the main features. Easy cartridge replacement. The cartridge can be replaced very easily. So in case after using for many years, and if you need to repair handpieces, okay, you send it to Thomasan, your NSK dealers in Indonesia, Thomasan Dental, and they can repair it immediately. You don't need to wait long day, many days, because it's very simple and easy cartridge replacement systems. Okay, and high precision gears. The high precision gears run quiet and are it's very quiet, quiet running noise. Doesn't make very rough noise because of the special gears installed. Okay, and if you choose FX23, it's a push button system. Okay, so very simple to remove and attach the bar. Okay, and it is autoclavable. Okay, so you can, of course, it's autoclavable handpiece, so you can autoclave as far as you're doing it every day. Okay, and because of this slim design head systems, the head design, okay, accessibility to the molars are very easily to do it with very good visibility. Okay, maximum accessibility is one of the features about this FX series, low speed handpiece. Okay, and air turbine handpieces in the student pack called Unair FX. Actually, this handpiece has many advantages. So I'd like to introduce what are these advantages are. Okay, so product features. This handpiece is made by stainless body, stainless steel. So it's very durable material. Okay, and high torque and high durability. The cutting power is very high cutting power. Okay, the body is very slim. Okay, slim designed, so easy to access to the molars. Okay, and air pressure regulating valve. This is kind of special air regulating systems. Okay, I will explain you this later. Okay, also anti-retraction valve. This is something related to the infection control systems. Okay, so these two I will explain you later on. Okay, so first, Unair FX has very strong cutting power, as I said. Okay, the cutting power is 20 watt. Okay, 20 watts is actually it's very high cutting power handpieces comparing to other brand handpieces. Okay, with this price range. Okay, of course. And very slim body with very slim, small head. Okay, design head. So that's why you can easily access to the molars with good visibility because of the slim body and small head. Okay. And pressure controlling systems, as I said, I'll explain you this later. Okay. Later. Our special handpieces. So apart from this handpieces, which are including in the student kit, there are another type of handpieces which I'd like to explain you now. Okay. So one of the handpieces is called FX Plus. FX Plus. This is new arrival handpiece, and it's currently available from our dealers in Indonesia, Thomasan Dental. Okay, so let me introduce this new handpiece. So this is, it looks like Unair FX, with the one which is including in the student kit, okay, but slightly different with more, different advantages. One of the biggest advantage of this handpiece is power, 30 watts, 10 watts additional to Unair FX. Okay? So if you are really looking for very powerful handpiece, this might be a good opportunity for you to choose it. This is the strongest power handpiece available from Nsk as of now. Okay, so the price is a little bit expensive than Unair FX, but not much difference actually. So you can contact Thomasan Dental later on for more details. Okay, this is a very powerful cutting handpiece. Okay, and another good point about this handpiece is that if you feel the standard head, there are different type of head sizes available for Nsk handpieces. Okay, Unair FX, the one I explained to you, which is including in the student kit, okay, that head size is called standard head size. Standard head size is very, very small design head. Okay, but some doctors are really looking for even smaller head because they want to operate for children's or the patients who cannot mouse, fully. Okay, so they are looking for even smaller head. Okay, so this FX Plus has mini head. Mini head is even smaller than standard head, as you can see, much, much smaller. Okay, and even though a small head for this FX Plus, the power is still very powerful, 27 watts. Okay, 27 watts with the small head. Okay, it's very, very good advantageous for you to choose if you're really looking for a small head. Choose an Nsk brand. Okay, so that's one of the another advantage of this FX Plus. There are two head sizes are available: standard head and mini head, and both head sizes having with very high cutting power torque. Okay, and additionally, okay, this is quarter spray handpieces. You will get water direction from 4 points for better cooling purposes. Okay, prevents a temperature rise in the dental pump. Okay, so this is the features of this FX Plus. Plus anti-retraction valve. Okay. Anti-retraction valve, as I said, this is including in the Unair FX also. Unair FX, which is including in the student kit. Okay, and also air pressure regulating valve. Okay, which I will explain you later. Okay, so that's one of the another handpieces available from Nsk. Very high power, high cutting power handpiece. Okay, if you want to use optic handpiece, is there any options from Nsk? Because basically, if you want to use optic handpiece, the dental chair itself, okay, dental chair needs to be equipped with electric systems in general. Okay, but is there any special handpieces available from Nsk without connecting to the electric dental chair systems? Actually, yes, we have very special handpiece called Dyna LED. Dyna LED. Okay, this handpiece is not required to connect it with the dental chair with the electric systems because it has dynamo, self-generating light dynamo system is installed, built-in. It's built-in dynamo system. It's this handpiece. Okay, so simply you just connect this handpiece to the dental chair, okay, air systems, and you will get LED light because of self-generating light systems. Very clever handpiece. And the light intensity, okay, is very bright, very high intensity, very bright light systems, 25,000 lux. So you get more visible, easy to see cavities, or easy to see the area you are cutting while you are doing treatment. Okay, so this is a comparison between optic and non-optic handpieces. It's a big difference. Okay, so maybe this is one of the another option for you if you are looking for optic handpiece. Okay, we have special handpiece called Dyna LED handpiece. Okay, so that's the introductions of Nsk handpieces for today. Okay, but as I said, Nsk handpieces, many doctor feels very durable, very strong. They can use it for a long time, many years without having any issues. Okay? But even the good handpieces, okay, even if you choose the good handpieces, okay, if you don't keep doing good maintenances, or if you don't handle the handpiece carefully, okay, maybe the lifetime of the handpiece is shortened. Okay, so how can you maximize the lifetime of your handpieces? Okay, so this is another topic for today: importance of handpiece daily maintenances. Okay, because maintenance is essential. It's mandatory for you to do it every day if you want to keep your handpiece lifetime as long as possible, maximize lifetime of handpiece. Okay, so maintenance is important not only for dental, it's important for your car, your motorbike, everything you need maintenance. Because if you don't do proper maintenance, maybe this is the result. For example, for the car or your mobile for motorbike. Okay, maybe without the maintenance, it may be stopped in the middle of the road, and you have to send it to the mechanics for repair because of the poor maintenance. Okay, maintenance for dental equipment, as I said, it's very important. Not only handpieces, dental chair, autoclave, compressors, and all other dental equipment mostly requires to do a good maintenance, continuous maintenance. But why do you think handpiece maintenance is important? Okay, as I said, handpiece maintenance is important. Why? Because handpiece is the direct instrument you use for patients. Okay, so you do the good maintenance because you want to maintain smooth cutting and good working conditions, okay, for your handpiece, and also for good hygiene control and safety use for patients. Okay. If you don't do good maintenance, maybe the handpiece won't rotate properly, or in the worst case, maybe break up in the patient's mouth because of poor maintenance. Okay, so that's the main reason. Maybe it may be fatal to the patient's life if you don't do a good maintenance. So that's why the maintenance is important for handpieces. Okay. Now I have one question to everyone. Where is the hardest part of the human body? Where's the hardest part? Is it bone or other parts of the human body? Okay. The answer is actually the teeth. And which part of this is the hardest? Enamel. Okay. So to cut enamel, we need to use something rotating very fast. Okay. Fast rotation. Okay. So that's why you need to use high-speed air turbine handpieces. Why it is called high-speed? Okay. Just example of your car engines. Rotation speed is about 3,000 to 4,000 RPM. Okay. Aircraft engines, about 10,000 RPM engine rotation speed. How about air turbine handpieces rotation speed? Any idea? Very fast. 400,000 RPM is the average rotation speed for air turbine handpieces. Very, very fast rotation, rotating of the parts for turbine handpieces. That's why you can cut enamel, the hardest part of the human body. Okay? And you can imagine that these handpieces are very high technology, high precision dental instruments. Okay? Because this is considered as a medical device. So it has to be a precise product. And to keep the good to keep the good working conditions, as I said, you have to do good maintenance. This is a mandatory for you to do it every day. Okay. So let me show you one example. One day in the clinic, the doctor purchased new dental handpiece from Nsk. Okay. At the beginning, this doctor feels the working condition is very good, cutting very smoothly, and he likes it. Okay. But just 1 month later, he suddenly noticed the rotation is not very smooth. It was working very well at the beginning, cutting very smoothly, but suddenly stopped working. Why is that? Is that manufacturer problem or is it handpiece problem? Okay, and he wonders. Okay. So he calls Nsk, he calls Samsung, okay, our dealers, to check up the handpieces if something goes wrong with the handpiece. Okay, so our engineer visit the clinic, received the handpiece, and this is what they found when they opened the handpiece. Okay, they found very rusty, dirty cartridge and the dirty gears. Okay, so first thing we can imagine is that how they are doing the maintenances every day in the clinic. Are they doing a proper maintenance within the short period of time? suddenly stopped working. So how's the maintenance conditions? Okay, so this is the real case actually. Because the good maintenance, if you continuously applying the good maintenances, okay, 1 month, duration of use of the 1 month period, you should not get like this. Okay, if you're doing good maintenance, the conditions of the gears, conditions of the cartridge should be like this. Okay, but this is the indication of not doing proper maintenance. Okay. As I said before, you use handpieces directly for patients for cutting the teeth. Okay, so if you visit dentist, if you visit dental clinic, and if doctor is using handpiece with these conditions, I believe you feel, oh, this is not good hygiene clinic, or I don't want to get treatment done with this handpiece because very dirty conditions. Okay, so please think about your patients also by doing good maintenance every day. Okay, so what was happening in this example in the clinic? Okay, in this clinic, every day actually they were lubricating, cleaning the handpiece, but first of all they were using a non-brand oil. Okay, and they were only cleaning once a day. But is this enough for lubrication? Is it enough for maintaining your handpieces, cleaning handpieces? Okay, so again, okay, so this is the concept of air turbine handpiece. Okay, as I said, the concept of the handpiece is this is an air-driven system. So air enters from the handpiece and rotating the cartridge. Okay? Cartridge rotates and rotates about 400,000 RPM. Okay? So this is how the handpiece, the air turbine handpiece work. Okay? As I said, it's a super high technology, roughly precision instruments. Okay? So how do you do the proper maintenance? What is our NSK advice? What is the advice from the NSK to all the doctors and student doctors for doing the proper maintenance for your handpieces? Okay, so let me show you. So this is the daily cycle as per of my advice, NSK advice to you. Okay, so after you use the handpiece, please clean or please wipe the handpiece, remove the debris or remove the paste or something from the handpieces first. Okay, and after cleaning, please lubricate. So you want to clean internal part of the handpieces. You want to clean cartridge, okay, by using the lubrication spray. And after that, you need to autoclave the handpiece. So this is the daily cycle. Okay, so first step is cleaning. Cleaning. Okay, so you can use tap water. You can clean with the brush, sponges, okay, and you can remove the debris from the surface body of the handpiece. Okay, after clean, please wipe. Okay, or you can use the wipe to clean the handpiece. Okay? But please do not use the wipe contains with a high percentage of the chemical solution, because using the chemical type wipe, it may cause discolorations of the body, stainless body. Okay, so please avoid using chemical type wipe or chemical solutions for cleaning handpieces. My advice to you is to use alcohol spirit, or alcohol type wipe only. Okay, and please do not use solutions, chemical disinfectant directly like this, okay? Because this is causing something like this problem later because of the chemical reactions. Okay. Please do not use ultrasonic cleaners. It is not recommended to use ultrasonic cleaner for cleaning handpieces, okay? Because you may damage cartridge. Okay, so after you clean, now it's time to lubricate, spray, oiling. Okay. Please see this video. Is this correct lubrication or not? Okay, so in this video, spray, okay, spray. But as you can see, the oil is coming back from the rear part of the handpiece. So it seems like the oil is not entering inside the handpiece and cleaning the cartridge. Something is wrong with this. Why? Why? What is the problem? Okay, spray nozzles. What is spray nozzles? So depends on this, the connections of the handpieces. There are different spray nozzles available. Okay. From Nsk, this is the most common type spray nozzles here. This is the tip nozzles. These tip nozzles to be used with the M4 direct connection handpiece. Okay. And if you are selecting to use the coupling type connection handpiece, there are different nozzles available, depends on the different design coupling systems. Okay. And one-to-one or quadrangular handpieces. This is known as E-type connections. E-type connection is actually internationally standard connection type. Okay? So not only Nsk, all other brand quadrangular handpieces are same connection, internationally standard connection type. Okay? So you have to select to use nozzles for these handpieces also. Okay? So this is what they use. Okay? Spray nozzles for direct connection type handpieces, and coupling for coupling type handpieces, and E-type connection, okay, for E-type connection nozzles, okay, for handpieces. So this is what you use, what you have to use. Okay. Now this is another common questions. Sometimes doctors are a bit confusing. Okay? Which hole you have to lubricate handpiece? Do you have to lubricate all holes or just a small hole, a big hole? Okay. Okay. The answer is this second smallest hole. The second biggest hole only. You just need to lubricate this second biggest hole. And this is the reason, because this second biggest hole is connecting pipe to the head. Okay? So from here, the air enters and the air is reaching to the head and rotating the cartridge. If you try to lubricate this big hole, as you can see, there's no pipe inside the handpiece. So the oil never reaches to the head sections. The oil only goes into the body of the handpiece. Okay, that's not the proper lubrication. You want to clean the head sections because you need to remove debris completely away from the head part, from cartridge. Okay, so please remember you need to lubricate only second biggest hole. Okay, no need to lubricate outer holes. Yes. Okay. Okay, so I'd like to show you one video. This is kind of the summary, what I have explained to you so far. Okay, so please see this. Handpiece maintenance. Please rinse, or you can use wipe. Okay, after use. Next step is lubrication. Please select correct type of nozzles. Okay, and if you are lubricating direct type M4, only lubricate small hole. Okay. For quadrangular handpieces, please use E-type connection. Okay, now ready to. Okay, in this video, looks okay, trying to lubricating to the second biggest hole. Okay, but is it enough? Is it okay to proceed like this or not? So something is missing in this video. What is missing in this video? When you lubricate the handpiece, okay, please remember to use tissues always. Because if you use tissue, you can see the color of the oil easily. If you don't use tissues, you don't know the handpiece has been cleaned completely, or maybe still the debris is remain inside the handpieces or not. Okay? So only the way you can check the color, I mean, conditions of the handpiece is to use tissues like this. Use tissues, hold the head, and spray continuously 2 to 3 seconds. Okay, and please check the color. If you see any debris, you have to do it again until the clean oil comes out. Once the clean oil comes out, that means all the debris from the handpieces came out completely. Okay, so please follow this. Please always use tissues. So this is this is my advising to all the dentists and all the students, doctors, okay, as the purpose of the daily cleaning. Okay, direct connection type, coupling type. Okay, if you are using a coupling connection handpiece, please do not lubricate from the coupling. Please remove coupling and use the appropriate designed nozzles, spray nozzles. Okay, connect to the handpiece, and use the spray to lubricate the handpiece. Okay. How about the chuck cleaning? Is it necessary to clean the chuck systems? Actually, yes. I would recommend to you to spray the chuck. How to clean the chuck? Where is chuck actually? Okay. Very simple. Please use this spray nozzle spray, tip nozzles attached to the spray lubrication bottle, and please lubricate here. Remove the bar and lubricate here like this. Okay. And by doing this, it removes the debris from the chuck sections. And this will actually help to maximize the lifetime of the chuck systems. Doing this and not doing this makes a big difference. Okay. So please follow this also. At least once a week is recommended to clean the chuck. Okay. How about low-speed handpieces? Low-speed handpieces also, good maintenance is essential, important. Okay. As I said, in the student kit, you will receive straight handpieces and 1-to-1 speed, low speed, okay? Low-speed handpieces. You must clean these handpieces also daily. Okay. As I said before, as the purpose of these handpieces, okay, air turbine handpieces are mainly used for cutting teeth. Okay. Low-speed handpieces doing polishing, finishing, or trimming, or something like that. Okay. But mainly, I would say the doctors are using these low-speed handpieces for doing polishing the teeth, using the polishing paste. Okay. So this is something different from air turbine high-speed handpiece because you use paste, polishing paste. Okay. And I'd like to show you this once again, the concept of the contra-angle handpieces. The contra-angle handpieces are made by gears, okay? Cartridge, drive shaft, and dog clutch. Okay, this is the basic mechanism of the contra-angle handpieces, low-speed handpiece. Okay, so please imagine if you use polishing paste for handpiece. Maybe the polishing paste enters from here, handpiece head sections. Okay, and if you do it continuously, and if you are not cleaning the handpieces, often, this might be the result. You will see the paste in between these gear sections in the head, in the cartridge part. Okay, because of the entry of the polishing paste and not doing the proper maintenance. Okay? So please remember, especially after using the polishing paste, okay, with the handpiece, please lubricate immediately. After the operation ended, please lubricate immediately, removing the tissue, using the tissues again, remove all the polishing paste completely away from the handpieces. Okay? So it is important to use tissues so you can see the color. You can identify the color of the oil. You can see clearly. Okay, so this is as per NSK's advice to everyone. Okay, And please don't forget to use nozzles. Please always use nozzles when you clean one-to-one contra-angle handpieces or any type of contra-angle handpieces. Okay. And don't forget to use tissues. Okay. As I said, please don't forget to use tissues. Okay. Just showing you this video once again. Okay. Please do it again continuously until you can see the oil, clean oil. Okay. Okay, now next step. Chuck cleaning. Okay, chuck cleaning is not necessary to do it for contra-angle handpieces because the chuck system is different from air turbine handpiece. You use CA bar, contra-angle bar, for contra-angle handpieces. So it is not required to do the chuck cleaning. But for air turbine, high-speed handpieces, you must do the chuck cleaning at least once a week, as I explained to you just now. Okay, because of the different chuck systems. Okay. How many times a day do you need to lubricate the handpiece? This is another commonly asked question. How many times a day? Okay. Answer is every day after each use. But if you are too busy or if you cannot do it every day, okay, please lubricate minimum twice a day, at least during the lunchtime and evening once you finish the cleaning. Okay, but ideally every day after each use. Every day after each use, please clean and please change handpiece and autoclave and change the handpiece for next patients one by one. Okay. How about lubrication oil? Is it okay to use any type of lubrication oil, or you have to use, it's better to use specific type of oil? Okay, so this is my question. On the market, you can find many different kind of oils, of course. Okay, and some doctors are a bit confusing because with too many brands available, they don't know which one to use. If you are not sure, answer is very simple. Please try to use Nsk spray, Nsk lubrication oil. Why it is recommended to use Nsk oil? Because this oil contains high percentage of alcohol. This is not drinking alcohol, it's a different type of alcohol, okay? As a purpose of the maintaining better hygienes and more effective cleaning purpose, okay? And in fact, depends on the different brand of the lubrication oil. Some oils has too many viscosity, too much viscosity. The oil is too thick. No? So if you spray, sometimes oil won't come out completely from handpieces, and the oil stays inside the handpiece. So what you will see is when you are doing treatment, when you are using it for patient, the oil keep coming out because too thick oil stays inside handpiece. So you don't want to see this kind of situations every time. So that is why it is highly recommended to select high quality oil. So Nsk are selling this special oil. Okay, we have oil. So why don't you select this oil for your daily maintenance purpose? Because of lubrication, cleaning, because of the high percentage of alcohol contains. Okay, and especially your low-speed handpieces, as I said, consist of gears, 3 gears. Okay, so you need to clean each sections of the gears, connecting part of the gears. Okay, and if you are using high viscosity type oil, as I said, the oil stays here. Oil won't come out from handpieces because of too thick oil. Okay? So oil quality is actually very important, especially when you are using for contra-angle, the gear type handpieces. And of course, it's important for high-speed handpieces, but especially for low-speed type handpieces, this gear type handpieces, you must select good quality oil. Okay. And So that's the reasons why you have to select good quality oil. Okay. Okay. The next is the infection control. As a part of the infection control, you have to change the handpiece every day, and you have to do a proper maintenance and autoclave every time after each use. Okay, because autoclave is the only effective, it's the most effective way to kill bacteria from handpieces. Okay, if not, you can imagine the increase of the risk of the infections. Okay, so we use okay, so that infection part, sorry, I will explain you later again. I have the slide is a bit different from my original one, so I need to just finish off with the cleaning part. Sorry. Okay, so lubrication. Okay, with the Play Plus, our Nsk oil. Okay, because of the high percentage of the alcohol contains, it more effectively cleaning. Okay, and better hygiene control. That's the main purpose of using this Nsk spray oil. Okay. So after lubrication, autoclave. Okay. When you autoclave, please don't forget to remove the bar. Okay. Please don't leave the bar like this, because after autoclave, maybe you may feel it is difficult to remove the bar because of the high temperatures by autoclave. So please remove every time. Okay. And before autoclave, please lubricate. Some dentists ask me before, should I lubricate before or after autoclave? Lubrication must be completed before autoclave, okay, not after autoclave. Okay. Okay, so after autoclave, now it's ready to use again. Use the handpiece again. Okay, so that's the daily procedures which you have to do to maintain the handpieces, okay, to maximize the lifetime of the handpieces. Okay, and that's one good, that is the one important point. But there's another important things to maximize the lifetime of the handpiece. Okay, that is the using of the correct air pressure. You must use good air pressure, because if you don't use the air pressure correctly, you may damage the handpiece very quickly because of overspeeding or from some other reasons. Okay, so let me explain you about this. So for each different type of handpieces, there is a specifications available. Okay, and this specification is including in the operation manual. It's a user guide, instruction paper. Okay, and if you read this instruction paper, there is the section called specification, and you can see how much air pressure you can use for your handpieces to design, recommended air pressure to use. Okay, so the example of this Pana Air FX, this is the student kit handpiece. The maximum air pressure you can use is 0.25 megapascal, 2.5 bars. Okay, so this is the air pressure maximum range you can use. Okay, and as I said, the reason why it is important is if you exceed, if the air pressure is exceeding the recommended air pressure, the cartridge rotates too fast, and because of overspeed, over rotation of the cartridge, you may damage the bore bearings, okay, the bearings of the cartridge. So it damages the handpieces very quickly. Okay, and why it is not good to use high pressure conditions like this video. Okay. As I said, the recommended pressure is 0.25, but in this video, the pressure is almost 0.4, which is too much pressure. Okay, because this will minimize the cartridge lifetime, damages the ball bearings, causing vibrations because of overspeed, and maybe this excess rotation speed increase the risk of safety. Maybe the ball will break out in the patient's mouth because of too fast rotation, okay, or causing some other, serious problem because of the overspeed. Okay, so maintaining speed is very important apart from the daily maintenance. How about low pressure conditions? If pressure is too low, like this is not reaching to, this video is not reaching 0.25. You can see the air pressure is much lower than 0.25. So you may feel the cutting power is not enough because of lower pressure. The cartridge does not rotate 400,000 RPM, slower than the speed. Okay? And when you feel the cutting power is not good enough, maybe you tense the apply more force, okay, to the cuttings, and by applying too much force is not good for bearings cartridge. So again, this will minimize the lifetime of the handpiece, damaging the handpiece very quickly because of excess of the force, too much pressure. Okay? And this is also causing the risk of the chuck problem. You may damage the chuck because of excess of the force, too much pressure applying. So that's why selecting the correct air pressure is important. Some dental chair is already equipped with the pressure gauge like this, but is this correct air pressure? Is this reliable or not? I don't recommend you to trust this air pressure gauge. Some dental chairs pressure gauge is not reliable, not working properly. And in fact, this pressure is not to be used for handpieces. This is different pressure. This air pressure is indicating the dental chair air pressure. Okay, and from the dental chair, there's long turbine hose. Okay, and by the time air pressure is coming to this the handpiece, okay, the air pressure is a little bit less than what you're getting from the dental chair. So the actual air pressure for handpiece, you must use the air pressure gauge and check the pressure manually. Okay, so this process usually when the Nsk dealer is installing the dental chair, a new dental chair, they check the air pressure, or the engineers in the university, they can check the air pressure for dental chairs. Okay, so they are the one who check the air pressure. But of course, you can buy this air pressure gauge. If you want to check the air pressure every time before using the turbine handpieces, you can do it. But now maybe you're feeling like, how can I check the air pressure every time? I'm too busy for studying or doing something else. I'm too busy, and this is additional cost for me. Do I need to buy this air pressure gauge, or I don't have enough time to do it, or it's too complicated? There are so many steps for handpieces, only using the handpieces. Why do I have to, check the air pressure every time? But please don't worry. We have solution for this. Okay? We do have solution. Now, as I showed you previously, Pana Air FX handpiece. This is the student kit handpiece, and also FX Plus. FX Plus handpiece is the one having with the very high cutting power handpiece, 30 watts cutting power. So these two handpieces are equipped with this special air pressure regulating systems inside the handpiece called pressure regulating valve. Okay. So what is pressure regulating valve? This pressure regulating valve is automatically adjusting the air pressure in case if you are using excess of air pressure. How does it work? Okay. So this is how it works. There's a special valve inside the handpiece installed. And in case of the overpressure, this valve activates to release the excess amount of pressure going out to the exhaust. So by the time the air pressure reaching to the head sections, you will only get necessary amount of air pressure, which is 0.25 megapascal. So excess of the air pressure, it will go out from the handpiece. So this will prevent against the overspeed of the rotations, damaging the cartridge. Okay, so it's a very unique systems, which other brand handpieces don't have. NSK is having this special systems. Okay? And as I said, this handpiece is including in the student kit. Very good point of having this student kit because of the special handpieces including in the student kit. Okay, so this is including in the student kit handpiece. Okay, and originally this system was installed for one of the most expensive premium NSK handpiece called Timax Z95L. Our premium handpiece is equipped with the systems, but even though with our basic economy type handpiece, is now having with the system, which is good point. Okay, this is a very good advantage for an Nsk handpiece. So by having the systems, of course, the safety increase, and it's a good advantage for an Nsk handpiece having with this system. Okay. So as I said, good lubrication and maintenance is very important, and using the good correct air pressure is also very important to maximize the lifetime of the handpiece. Okay? But please do not also forget, don't forget to use good quality burrs also. Why important? Because failure to select correct type of burrs or using the poor quality burrs also increase the risk of check problem and safety issues. Okay? So my advice to you is please always use ISO standard high quality burrs. Okay? Please do not use low, very cheap burrs, very low quality burrs. Always select to use ISO standard burrs. Okay? If you see the bar is bended or rusted or damaged already, please do not insert to the handpiece. You may damage the check sections of the handpiece. So please change to the new bars. Okay. As operations, please insert the bar fully until the end. Okay, for the push pattern, okay, until you feel its end of the check. Okay. Do not insert only halfway, please. And please wait until the bar completely stops. If the bar is rotating, please do not push the push button. You may damage the check or you may damage the push button. Okay, so that's the operation part. So next part is daily infection. Okay? Daily infection is important, and not only for dental. We daily, we wash hand, we gargle, we wear mask because we want to protect against infections, against flu. Now these days against COVID-19, we wear mask every day against this. Okay, and in dental, you have to do good hygiene, controlling hygienes for instruments, dental chairs, autoclave, and or for any type of dental equipment, you have to maintain good hygienes. Okay? But in dental, especially for handpieces, dental instruments, cross-infection is now everyone's concerns. Okay? Because as I said before, you use dental handpieces directly for patients' mouths. You use it directly for patients. So now doctors' concerns is the cross infections. So where the cross-infection is coming from? From direct contact and by aerosol, most likely from these two. Okay, so how can we minimize the risk of infection against these two things? Okay, so we have missions. Nsk have missions. Our missions is to help minimize the risk of infection by reducing aerosol levels and reducing contaminations into handpiece and chairs, dental chair. So our handpieces have special mechanisms against this, against minimize, against the risk of infection. Okay, so I'd like to explain you this special systems. An example of direct contact. If you don't change handpieces one by one for next patients by patients, you can simply imagine, because of the cross infections, blood, saliva, oral, mucosa, and so on, okay, the chances of the infection will be increased if you don't change handpieces. Okay, because you use handpiece directly for patient's mouth, inside the patient's mouth. It's a direct contact. So that's why, as I explained to you before, you have to maintain the handpiece. You have to do a good, proper maintenance every day. Change the handpiece every time after each use. You have to autoclave the handpiece. So this is the process. But if you don't do it, you can simply imagine the chances of infection will increase the risk of cross-infection. So you need to avoid this. Okay. How about the handpiece itself? Does it have any special mechanism to the handpiece? Okay. So now I'd like you to see this. So this is how it works. As I said, air is going inside the handpiece and rotate the cartridge, and it comes out from the head sections. Okay. When you stop pressing the foot pedal, what is happening is the cartridge stops. Okay, but the cartridge, it doesn't stop immediately. It rotates few seconds, 1 to 2 seconds rotate, okay, even after you stop pressing the foot pedal. Okay, so during this time, what is happening is because the cartridge is still rotating, air, it tends to return back to the dental chair side due to negative force phenomenon. So this is kind of the negative force phenomenon. Okay, so if the handpiece is still inside the patient's mouth, okay, you can imagine this suck back the saliva or blood or something else, oral fluid, and this sending back to the dental chair side because of the negative force phenomenon. Okay, so we need to avoid this. We have to avoid this because
Yoko, excuse me.
Yes, please. Hello.
Hello, Mr. Yoko.
Yes, I'm here.
Actually, your time is up.
The time is finished?
Yes.
Okay.
I'm sorry.
Okay, sorry about that. Okay, just can I just have 2 minutes to this? Okay. So NSK is having a special system in the handpiece called clean head system. Okay, clean head systems prevents against the entry of the fluid inside the handpiece like this. Okay, this is the protection, clean head systems. And another one is called anti-retraction valve. So this anti-retraction valve is also including in the student kit handpiece. Okay, so this anti-retraction valve protects against the entry of...
Mr. Yoko, excuse me. I'm sorry, you still have 10 minutes. I'm sorry.
Okay. Yeah, I will continue. Okay, right. Okay, so this is the anti-retraction valve. Okay, protecting against the reverse flow of the water line. Okay, with the anti-retraction valve and without anti-retraction valve. So with this system is installed inside the handpiece, the student kit handpiece. Okay. Okay, and you can also upgrade your handpiece if there's no this systems installed ARV. We have these adapters. Okay, so by connecting this adapter, the handpiece will be functioning anti-retraction systems. You can simply connect this adapter and you can connect to the handpiece. And you will get this function. Okay. Okay, so that's the infection control of Nsk handpieces. Okay. And as I said, this system is including with the student kit high-speed turbo handpiece. Okay. So before I conclude this presentation, I'd like to show you one quick video to everyone. Okay, thank you for your attention. So please be aware of Nsk fake products. Okay, so you can only buy original Nsk products currently in Indonesia from Thomas & Dental. Okay, please do not buy from online, internet, or from third parties. Okay, even the price is very cheap or with a special discount. Okay. Maybe it's not original Nsk. You can find many fake Nsk products everywhere in the world now. Okay, so our official distributors in Indonesia is Thomas & Dental. So they are the ones selling original Nsk products. So I just wanted to mention you, please don't be a victim of having fake handpieces. Okay, so this is very important. Important point as the conclusions of this presentation. Okay, so thank you very much for your attention today, and I hope you learned an importance of daily maintenances, having a good air pressure, using the good pressure systems, as well as the features of Nsk student kit and some advanced handpieces. Okay, thank you very much. Thank you.
Okay, thank you very much, Mr.
Yes.
Yoko, and it's very nice presentation.
Thank you very much.
Maintenance our handpiece. Yeah, and I think it's very important for us to know that we must immediately clean and lubricate our handpiece.
Yes, thank you.
Okay, thank you. We go to the Q&A session.
Yes. Okay, so I still have time for Q&A,
yes.
Right? Okay. Yes. So I would like to give you everyone question and answer time. Okay. And as I said, as I promised, okay, I prepared some special gift for you today. Okay. So first, I give you the question. Okay. So first person's answered, okay, to these questions. If you know the answers, please simply type the answer in the chat area. Okay. And the first person who got the right answers will receive the special gift from Nsk. Okay. So are you ready? Is everyone ready to type answers? Okay.
The participant, are you ready? Because there
Yes.
is, if you have the correct answer, will be received the special gift, yeah,
Yes. Yes.
from NSK.
By Thomas and Dental later to the students. Or the,
Okay.
okay.
Are you,
So first question. Okay, I will give you this special NSK and Harakiti collaborated clear file for it. Okay.
Sir, may I answer the question?
What is the average rotation speed of high-speed air turbine handpiece? Very simple questions for beginning.
Okay, Mr. Yoko, we have the from Dr. Soraya Arwidi. He say 400, but I think with the chat column from Linda,
Yes.
400 and
Yes.
1000 RPM. Yes.
Yes, already got
Linda.
answers. 400,000 RPM. Yes. So
Yeah.
as I explained. Okay.
The correct answer is from Linda.
Linda. Yes.
Linda. Yes.
Okay, Miss Linda. Yes. Thank you. Thank you for your correct answers. Okay.
Okay.
So let's go to the
Any more?
maybe a little bit difficult. What is the name of the air turbine handpiece, including in the student kit? What is the model name of the handpiece I explained to you today? Does anyone know?
The question is, what is the model name of the air
Yes.
turbine handpiece,
Air
including
turbine
the
handpiece,
student
the
kit?
one I explained you today.
From Mr. Teuku Hafiz, FX Plus.
Oh,
Is that
FX
correct?
Plus is another type of handpiece,
Oh,
not
another.
in the student kit.
Oh, okay.
Yes, but FX
Anyone
Plus, yes.
can answer. You can fill in column chat the
Yes.
name of the air turbine handpiece.
Yes,
Okay,
so
from Mrs. Felinda Lucia, Pana Air
yes,
FX.
Pana Air FX, correct. Yes, Pana Air FX is the handpiece which comes with the student kit. Thank you for your answers. And thank you for remembering Nsk Handpiece. Okay.
So the correct answer is from Mrs. Felinda Lucia, yes. Felinda
Yes.
Lucia. Okay.
Thank you. Thank you very much.
Any more, sir? Any question? Any more question?
Yes, I have more questions. Okay. And to maintain the handpieces, good working conditions, how often do you need to lubricate the handpiece? This is an easy question.
How often do you need to lubricate the handpiece?
Yes.
From Mrs. Sylvia, twice a day.
Twice a day is only if you cannot do it. Okay, someone got answers every day.
Teuku Hafiz, once a week.
That's the check, cleaning the check.
Ganisa Sindan, every day.
Every day after each use. Okay, so someone got answers already.
Mrs. Putu Yuri Divida, after using and once a week.
After using and once a week is the yeah, that's also correct answers. But once a week is only for the cleaning the check.
Okay.
Yes.
Other from Sylvia. She said that after use per patient.
Yes, that's also correct. Yes.
That's the correct.
Okay.
So the correct answer is from Mrs. Sylvia, sir.
And every day. So whoever answered every day and after use per patients is the correct answers.
Oh, so which one? Because Mrs. Ganiza said every day, but Sylvia said that after use per patient. Which one?
I need to say after use for patients is a better answer.
Okay. So the winner is from Mrs. Sylvia.
Yes.
After use per patient.
Thank you.
Okay.
A few more questions if I have time.
Okay. I think it's very interesting and all of the participants is wake up.
Now I have different gift for you. Now I have this keychains, Harakiti and Nsk keychains, made in Japan.
Okay.
Kitty products. Okay. To maximizing the lifetime of Nsk air turbine handpieces, what are the two important procedures? Number one is good lubrications and maintenance. Okay. What is another one? I explained two things today.
Oh, there is two things.
Yes, one
two
is
important procedure.
Yes.
Okay.
Lubrication is number one.
From Sylvia said that cleansing and lubricant. Oh,
That's number one. Yes.
Number one, using the correct air pressure.
Yes. Maintain pressure. Correct.
Finally.
Maintaining, operating with the correct air pressure is very important.
Okay, finally, Mr. Teuku Hafiz.
Yes.
You're correct.
Thank you for your answer.
Using the
Thank
correct
you.
air pressure.
Okay, so continue.
Continue, sir.
Yes.
Okay.
Handpieces are equipped with a special system prevents against the entry of oral fluid. So this was my last presentation part. What is the name of this system? Sorry, I was explaining a bit quickly, so maybe I didn't mention this clearly, but does anyone remember this?
Okay, from Felinda Lucia said ARV.
ARV is another one.
Another one. Okay.
This system is in the head part.
From Mrs. Linda, black valve.
Something block valve is something to ARV.
Okay. The other.
Another one. Sorry, maybe I didn't explain you clearly. So I give you answer for this. This is called clean head systems.
Oh, clean head system.
Clean head systems protects the entry of the oral fluid back to the dental care side. Okay, so this system is equipped for all NSK air turbine handpieces. That's the purpose of infection control. Okay. So next question, I'll give you this hearing for 2 persons because for this one, okay, just skip for this one.
Okay.
As a purpose of another type of the infection control, okay, there is a system called ARV. What does ARV stands for? What is the meaning of ARV? Okay, one person got it.
Okay, Mrs. Felinda Lucia said anti-retraction valve.
Yes, correct. Anti-retraction valve. Thank you very much for your answers. Yes.
Oh, correct answer from Mrs. Felinda Lucia.
Yes, this is called anti-retraction valve. Okay. Yes. And this valve is installing inside the air effects. That's the purpose of the during infection. Okay, thank you for that.
Okay, sir. The other next
this
question.
This is the
sir.
last question.
Oh, last question.
No, I have 2 more questions. Sorry. Okay. Does anyone know the name of this special LED? Oh, got it. Yes.
Teuku Hafiz, LED.
Okay, thank you for remembering. For Dynar LED handpiece.
Dynar LED.
With the self-generating dynamo systems installed. So
Mr. Teuku Hafiz have been answered 2 questions. Correct.
Oh, that's good. Thank you. Thank you very much. Okay, Dynar LED handpiece. If you look up handpiece, this is a good option for you to select. Okay, last question.
Okay.
For lubrication, which hole do you need to spray? Second biggest, yes. Second biggest hole is the correct answer.
Okay, from Mr. Basby, second biggest.
Yes, second biggest hole. Because, as I said, the purpose of lubrication is to clean the head sections, cartridge. Okay, and if you spray the second biggest hole, this hole is connected to the pipe. So this pipe all the way to the head, okay, reaching to the head cartridge section. Okay. So this is the only area you need to lubricate. If you lubricate big hole, there's no pipes. So you cannot clean the head sections. Okay. So please continuously lubricate second biggest hole so that you can clean the cartridge properly. Okay? And using tissues. Okay? Please don't forget to use tissues. Okay, so thank you very much. Terima kasih.
Terima kasih.
Thank you. Yes, thank you.
Okay, sir, maybe there is a participant who want to ask you some questions.
Questions, yes.
Do you have any time?
Yes, please go ahead.
Okay, for the participant, if you have any question, you can directly ask to Mr. Yoko? Please. Anybody want to ask to Mr. Yoko, please? You can ask directly or fulfill your question in column chat, Q&A. Anybody want to ask? Yeah, from Mrs. Ratu Sofia. Good morning, Mr. Yoko. As a preclinic student, we use handpiece for phantom. What should we wait?
Yes.
Yes. I'm sorry. From good morning, Mr. Yoko. As a preclinic student, we use handpiece for phantom. What should we do to maintain the machine of our handpiece? Because sometimes it cannot work well. So what for phantom? So
Okay.
this student and she used her handpiece on phantom. So she asked you, what should he do to maintain the machine of her handpiece, because sometimes it cannot work well. It's not working well.
Okay. First of all, even though if you're using for phantom, you have to do our good maintenance. By handpieces and low speed handpieces. Okay, so my question is how often you are cleaning the handpiece. So you are not using it for real patients, so you don't need to change the handpieces every time for each phantom. Of course, it's not real patients, but still, sometime during the classes you need to practice 1 hour or longer using the phantom. Okay, so during this time, maybe the cutting powder or something get inside handpieces, the debris get inside handpieces. So my advice to you is, even for phantom, after the class finished, please lubricate every time for each use. It's highly recommended.
Okay.
Even though if it's not the real patients, please try to lubricate using tissues. Remove all the cutting powders, debris away from the handpieces.
Oh, okay. So the same even we use phantom or real patients, sir.
Yes, correct.
Must be cleaning and must be lubricate every single patient.
Yes, that is highly recommended to maintain good working conditions.
Okay.
And as I said, maybe that might be the air pressure. Air pressure may be too high. The setting with the phantom chairs. So maybe it's better to check the air pressure. If you feel you are getting the damage, if you feel the damages the handpieces continuously, please try to check the air pressures.
Thank you very much.
Air pressure is too low, so you feel the cutting is too weak, or if the air pressure is too high, maybe the burr vibrates or making some rough noise or something like that. So air pressure is very important.
Okay, so even in real patient or in the phantom must be cleaning and lubricate.
Yes,
that's
correct.
The important point, yeah.
Yes.
And use Nsk handpiece.
Yes, please. Yes, because of the multiple advantages, as I said. Yes. Infection control and pressure systems.
Okay, thank you very much, Mr. Yoko. Yes,
Dr. Nur,
yes,
can I ask some question to Mr. Yoko?
Okay, please.
Yes, thank you very much for Mr. Yoko for
Thank you very much. Thank you.
Yes, I have 2 questions.
Okay.
Mr. Yoko. Halo Bu Injin.
Hello.
So I have
Mr. Yoko, he is our vice dean, Mr. Yoko. Dr. Andra.
Okay.
Yes. So I have 2 questions, Mr. Yoko. So
Yes.
first of all, as we know in the marketplace or maybe in the market, we can see that the fake Nsk handpiece.
Yes.
And my question is how we can make a difference between the real one and the fake one.
Please buy from Thomas Dental. Okay.
Yes.
Now these days it is very difficult to see the differences also. You know, those handpieces mainly coming from China, as you know.
Yes.
They are very clever and professional in copy identical products, as you know. Okay. Now, if I see, I can tell the differences. Like the head cap color is different, logo is different, the package is different, and so on. Okay, but the easiest way to find it out is if you feel the price is cheaper, dramatically cheaper than the price from Thomas & Dental, the original price. You should think about it might be not original, maybe fake. Okay.
But it happens also, Yoko-san, that somebody sell it at the NSK price, but with a fake product.
Then it's
that's difficult, Mr.
Uncontrollable. So please buy from Thomas & Dental.
And the second question,
yes,
Mr. Yoko. So I'm an oral and maxillofacial surgery.
Okay.
So I usually use the straight handpiece.
Yes.
And which I bought from Thomasong, the real one, not the fake one.
Thank you, doctor. Yes.
and I have an experience.
Yes.
Mr. Yoko. So many times I have a student, my specialist program student.
Yes.
So they also use that straight handpiece. And they always broke it, Mr. Yoko.
I see.
But for myself, I use it myself since 2005.
Wow.
2005 until now, it's still working.
I see.
Yes. Which I bought from Thomasong.
I see.
So I mean that maybe for the treatment after we use for the operation, I think that the treatment is really important and necessary. Is it right, Mr. Yoko? So how does it the treatment?
You mean you're talking about maintenance?
Yes, maintenance.
Yes. You are correct. Yes. So from my experience, now as I said, I'm also working as engineers. I do repairs of handpieces also as apart from sales part. Okay, and 90%, maybe almost 100% of the straight handpieces or surgical handpiece damage is caused by the lack of the maintenances. So the blood dried up and the blood clogged inside handpieces because of the blood is not coming out completely when the doctor is doing the maintenances. So my advice for the maintenance, the cleaning the handpiece, straight handpieces, after the operations, please do not leave the handpieces like 1 hour or 2 hours. Don't keep it. Please lubricate immediately after each operations using the tissues and remove the blood completely away from the handpieces. So as long as you use the tissues, you can see, as I said, you can see the color of the oil. Okay, so please spray until the clean oil comes out. Until you can visually see the clean oils comes out from the handpieces. And when you continue these procedures, it will last for a long time. Actually, the handpiece lifetime long. You can maximize lifetime. But if you miss these procedures even one time for surgical handpieces, the blood easily dry up. The blood is very easily dries up. So once it dries up, once it's stuck inside the handpieces, it will be difficult to remove it. So just please remember, every time for surgical purposes, all surgical handpieces must be lubricated immediately after the operations. So this is my advice to all doctors as the purpose of maintenance of handpiece.
So how about if I, after finish my operation,
yes,
I merge with the disinfectant liquid?
I see.
Is it okay or
this?
No?
Yes, some liquid contains the chemical, solutions. I don't recommend you to soak the handpiece in the liquid directly, because if the liquid is made by chemical solutions, it may damages the internal parts. And especially when you're doing the autoclave, and with the heating and the chemical solution, sometimes it causing the chemical actions by heating. And that is another reasons why you get, the clogging problem, or the gear parts get rusted because of the chemical solutions. So as an Nsk, we are only advising to spray it and clean the surface, surface bodies. And as long as you are doing proper cleaning immediately after each operations, you won't get, handpiece problem that, that fast, quickly. I mean, yes.
Yes, thank you very much, Mr. Yoko.
Yes, thank you. Thank you. Is it clear answer for you?
Oh, clear and satisfied.
Okay, thank you very much. Thank you, doctor. Okay.
Okay, any more? We still have time if anybody want to ask to Mr. Yoko.
One question, please, Dr. Noor.
Please, Mrs. Putu Yuri Divina.
Yes, hello, Mr. Yoko. I want
to
ask, yeah. Is that okay if amount of water and soap I use for cleaning is entering the handpiece hole? Thank you.
It should be no problem. Yes, even the water enters inside the handpiece while you're doing cleaning, should be no issues. It's okay.
Thank you, Mr. Yoko.
Okay, but please avoid using disinfectant solutions. Okay, please be careful against the disinfectant solutions enters into the handpiece. And if you autoclave it, okay, it may be causing some chemical reactions by heating, as I just explained to the doctor. Okay. So
how about liquid soap?
Liquid soap, yes, that's another thing. So it depends on what kind of soap you are using also. But if you feel the soap is too much, please rinse it after clean. Rinse with the clean, the tap waters or clean waters after using the soap.
Thank you.
Okay, thank you. Thank you.
Okay, thank you, Mr. Yoko. Anybody, any question? Okay, I think it's enough, Mr. Yoko.
Okay.
Thank you. Thank you very much. And ladies and gentlemen, we finally come to the end of this session. And before I get back to the MC, I would like to take the conclusion from what the speaker has presented. For the first thing, we have to remember that only buy original product and escape from Thomasong.
Yes, please.
And then we have to remember that the important thing is maintenance of our handpiece. For the first step is must be cleaning, and second is must be lubricate.
Yes.
Must be lubricate immediately after we use. Maybe that's the important thing that we have to remember. And I'd like to thank to the speaker for the informative and interesting material, for the interesting presentation, and very, very applicable. Thank you, Mr. Yoko.
Thank you very much. Thank you for this opportunity also.
Thank you. And for all the participants for the participation today. And thank you very much. I say thank you very much. And Assalamualaikum warahmatullahi wabarakatuh. Dr. Ratna, the floor is yours.
Thank you, Dr. Nur. Thank you, Mr. Yoko, for your presentation.
Thank you very much. Thank you, Doctor. Thank you.
Okay. Now, may I request Dr. Andra Rizkiawan, Dr. Gigi, PhD, Spesialis Bedah Mulut dan Maxillofacial Consultant, to give certificate as an appreciation to our third speaker today, Mr. Yoko Suzuki.
Yes, for Mr. Yoko, this is the certificate of appreciation.
Thank you very much.
As a speaker in our Stovit Online Series 2021. This is, I think, this is your second time.
Yes, it is. Yes.
Yes.
Second time. Yes.
Second time. I think we will wait for the next year or the next term as a speaker again.
Definitely, yes. Yes. Anytime, please let me know so I can be a speaker. Yes. On behalf of NSK.
Thank you very much,
Mr.
Yoko Suzuki. Arigatou gozaimasu.
Arigatou gozaimasu. Thank you very much. Thank you. Thank you.
And now, may I request Dr. Andra to give certificate to our moderator, Dr. Gigi Nur Hikmah, Spesialis Konservasi Gigi Konsultan from Universitas Hasanuddin.
Baik, saya ucapkan banyak terima kasih kepada Dr. Nur Hikmah, Dr. Gigi Spesialis Konservasi Gigi Konsultan, sebagai moderator di acara Sertifikat Online Series 2021. Terima kasih, Dr. Nur. Semoga sehat selalu dan sukses selalu.
Baik, kita memasuki. Ya, terima kasih Dr. Nur telah menjadi moderator di sesi hari ini.
Sama-sama, terima kasih banyak.
Baik, kepada seluruh peserta Stovit Online Series hari ini, mohon untuk menyalakan kamera karena kita masuk di sesi foto bersama. Monggo dinyalakan. Selamat siang, Prof. Sugeng.
Prof. Sugeng, selamat siang. Assalamualaikum.
Masih di mute, Prof. Ya, masih di mute mungkin, Prof. Sugeng. Panitia, apa Dr. Gea atau Dr. Dea? Ya. Oke, bisa dimulai mungkin Dr. Ratna. Siapa yang mau take picture? Mr. Yoko, are you still there?
Yes, I'm still here. Yes.
Please, we will take a picture together, Mr. Yoko.
Okay. Okay.
Okay, so I will take the picture. Okay, 1, 2, 3. Okay, for the next slide. Okay, 1, 2, 3. Okay, for the third slide, there is no one who turn on the video, but it's okay. I will take the picture to all the participants. Last one. Okay, Mr. Yoko.
Okay.
Thank you very much for your nice
Thank you
presentation.
very much.
Thank you very much.
All participants. So, Dr. Ratna, please.
Okay, on behalf of...
Thank you very much, Mr. Yoko, for your lectures.
Thank you very much, Doctor. Thank you.
Okay, on behalf of Stovit Online Series Committee here today, I would like to send my gratitude to our speakers for taking the time to share your knowledge to us, and particularly to our sponsor, Ipoclar, Vivaden, and Tomasong. Last but not least, to all participants, thank you for joining this seminar. Hopefully, we will meet again in the next agenda. Wassalamualaikum warahmatullahi wabarakatuh.
Salam.
Assalamualaikum warahmatullahi wabarakatuh. Terima kasih semuanya.
Assalamualaikum.
Waalaikumsalam warahmatullahi wabarakatuh.
Waalaikumsalam, Prof. Sugeng.
Ya,
Semua dari konservasi, dari proses semuanya.
Terima kasih.
Terima kasih semua.
Dr. Andra,
Terima kasih, Dr. Prima.
Dr. Mareta.
Dr. Mareta, Dr. Nur, Dr. Nur, terima kasih.
Terima kasih.
Sehat-sehat semuanya, sehat-sehat semuanya.
Alhamdulillah, barakallah.
Matur nuwun.
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Terima kasih Dr. Andra.
Makasih.
Ya, Dr. Nastiti, Dr. Gea, Dr. Rere, kita evaluasi dulu, jangan leave.
Sudah Kak Dok, ini saya mau tabrak akun hostnya Dok, biar
Ya boleh,
bisa
tapi kita evaluasi dulu panitianya. Ya, oke.
Bentar Dok ya, saya tak login yang 20 di HP, saya di atas.
Ya. Terima kasih untuk semuanya, kita ketemu lagi mungkin tanggal 1 Mei ya Dr. Dea ya. Ya, 1 Mei ada seminar Stovit online series lagi. Prof Sugeng jangan bosan untuk bergabung, Prof.
Alhamdulillah, insya Allah enggak. Selalu, mulai pagi.
Nggih, matur nuwun supportnya, Prof.
Dok, izin saya live atau saya...
Ya, terima kasih, Dr. Nur. Terima kasih banyak.
Oh iya. Makasih banyak, Dok.
Teman-teman di Unhas. Sehat selalu, Dr. Nur.
Ditunggu, mohon maaf kalau ada salah-salah, Dok.
Tidak. Terima kasih, Good. Ya. Assalamualaikum warahmatullahi wabarakatuh.
Saya live ya.
Ya, monggo matur nuwun. Dokter Ratna juga nggak boleh live, kita evaluasi dulu ya.
Siap, Dok. Mas, Nek, kirim. Sudah ditutup?
Belum.
Pas sudah tutup itu?
Belum.
Sampun Prof Sugeng boleh selesai.
Oh, saya boleh selesai ya.
Boleh Prof, sama Prof Sugeng juga. Terima kasih Prof Kun untuk supportnya untuk hari ini.
Sama-sama. Saya ngenteni sesuatu tiba itu.
Apa ini Prof? Nunggu apa Prof?
Taklif ya. Matur nuwun, taklif.
Nggih, matur nuwun.
Assalamualaikum.
Waalaikumsalam warahmatullahi. Dokter Dini baru kelihatan. Jangan live. Nanti sore anu ya. Nge-host ya.
Jam 2 ya berarti ya?
Ya, jam 3-nya Makassar, jam 2-nya kita. Yuk. Mari kita evaluasi langsung saja. Dokter Aksannya ada nggak ya? Tadi Dokter Aksannya ada di tempat lain.
Ya.
Oh, ada Dok.
Dua minggu lagi mahasiswa semester 2 saya wajibkan untuk ikut.
Boleh Dokter. Boleh. Ya memang begitu Dokter.
Iya.
Jadi ya.
Itu memang bagian dari pembelajaran.
Betul, guys, siap. Supaya nanti terdetek.
Dan pembicaranya sudah membuat skenario sendiri dengan teman-teman semester 2, adik-adik semester 2.
Oke, guys, siap.
Jadi mereka sudah kontak-kontakan, nggak tahu ada game semacam ada interaktif apa gitu loh. Jadi nggak hanya sekedar ceramah aja, tapi semacam ada gamesnya atau apa gitu.
Siap.
Udah Dok. Wes tinggal 9.
Ya. Tinggal kita jodoh ya nih ya.
Yes.
Oke. Dokter Setiabudi belum? Nanti kasihan Dokter Setiabudi terlalu banyak tugas nanti.
Ya, saya tak ininya.
Ya.
I love you to the bone.
Gak usah